And I say decision-making moments, not just decision-making spaces or rooms, because it always comes down to a moment of making decisions. So we want to see these things taken from here to those critical moments of decision making and to the communities where this action become meaningful. For a 14-year-old girl who visits a health facility or who's in school who needs comprehensive information to make choices that can save their lives. Or a 21-year-old young woman who lives in a community where she's faced with all kinds of discrimination because of gender norms that are negative. Today, this conversation is really culminating to a point where we are demanding for change. And we call on you today as we interact, because we're going to have an interactive session at some point, that we contribute to this conversation, and beyond that, take this from here to those moments of critical decision making. Thank you very much.
Thank you so much, Toyin. I think the biggest disservice about having this conversation here is that we're competing with quite a lot of vibrance in the room. And I hope you can hear everyone clearly. If not, really, I apologize. We did not expect to have so much cross movement of noise around the room. I'd like to take this opportunity to also acknowledge my co-moderator, Faith. Faith Tipe. Faith is someone I started working with just over 2 years ago. And one of the things that when it comes to working with adolescent girls and young women is that moments of learning, very much like moments of decision making, never end. And I'm constantly inspired by what I learn from younger people. And yesterday, by the way, I was in another session. It was an intergenerational dialogue. And for the first time in my life, I was deemed an older person giving advice to the younger generation. My ego is still a little bit bruised, but I take that honor with pride. Faith will also be reading out some words from two of our young people who could not make it today. We're also running a protest, by the way, that many young people could not make it to Munich for this conference because of visa denial. And we're trying to occupy every space by acknowledging their presence and not replacing them. And so we will be holding space for every young person that did not make it to Germany because of ongoing colonization and colonial rule when it comes to the global health agenda. I'm now going to hand over to my amazing panelists. When the idea for this session came up, actually, it was Kimberly that had inspired a conversation around adolescent girls and young women. And particularly, one of her biggest protests is recognition of young moms in this space. I'm going to hand over to Kimberly and then over to Mioba. They're going to introduce themselves and tell us a little bit about their journey in this work that they do. Over to you, Kimberly.
Good morning, everyone. So my name is Kimberly. I am from Trinidad and Tobago. I am currently the Vice Chair of Y Plus Global. I represent the Trinidad and Tobago community for positive women and girls living with and affected by HIV. So when we were doing the planning for these sessions and for the sessions for the Youth Pavilion, one thing that I noticed was missing from the sessions was a session around adolescent girls and young women, and specifically having conversations on the issues that we face in this space, because there are a lot of challenges that are unique to adolescent girls and young women, especially those who are young mothers as well. A lot of the times, all the challenges that we face, because I'm saying we because I'm part of that group, we faced are not spoken about enough, and it isn't looked at enough. So for example, I want to go all the way back to when COVID was a thing and the height of COVID, where in my region, in the Caribbean, the English-speaking Caribbean, HIV positive mothers are not recommended to breastfeed their children. And when COVID happened, and they could not breastfeed their children. A lot of them couldn't work, and they didn't have jobs, so they couldn't provide food for their children. They couldn't afford to get milk for their children. And even though the government says we support you, we give you milk for the babies, a lot of the times there was a delay. They weren't getting the support that they needed. The systems that they had put in place were not effective because nobody anticipated COVID happening. And we are seeing the ripple effects of that till this day, because a lot of them have not still been able to go back out to work, have not been able to live lives normally. So a lot of the challenges they face were not being brought up. They weren't speaking about it. I have started speaking about it from then till now to government agencies. In every session or every space that I'm given, I always bring up the topic of, okay, what about young mothers living with HIV? They have all of these challenges, all of these hurdles that they have to overcome, but we continuously have the conversation, but we leave out this specific group. So it is something that's very close to me, not just me because I'm a young mom, but I look at it from those who are younger than me, who are going to more or less be in the same situations that I am in, because we could never tell what can happen. So I have been advocating vigorously for quite a number of years to have the breastfeeding policy in Trinidad and Tobago revised to allow HIV-positive mothers to breastfeed their children. So it's a work in progress. I have made progress, and now I have gotten them to revise the national breastfeeding policy in Trinidad and Tobago to formulate guidelines where HIV-positive mothers can breastfeed. And I'm also currently on the technical steering committee for Trinidad and Tobago's national HIV and AIDS policy, where in that policy as well, I have actively gotten them to put steps in place and add things to allow HIV-positive mothers to breastfeed in Trinidad and Tobago. So it's a work in progress, but I'm getting there because I won't shut up about it. So now they have to listen to me. They have no choice.
Thank you so much. Allow me to confirm if you can hear me. Okay, great. It's always nice to share my personal and professional journey when it comes to supporting adolescent girls and young women. So my name is Mioba Benzu. I am a programs manager at Koparo Zambia. Koparo Zambia is a youth-led and youth-serving organization that exists to build a conducive environment for young people to thrive. We take a holistic approach in promoting and supporting healthcare services and needs for adolescent girls, for adolescent boys, and for young people in general. Talking about my personal and professional journey in this work that we do, we get back to the time when I was in my 11th grade in secondary education. At that time, I had a lot of questions that I was asking because I had just lost a 21-year-old cousin due to AIDS. And when I tried to ask around the family members, because I was very young, trying to understand what AIDS really was and what it meant, why my cousin, who was just 21 years old, died, they didn't really have answers for me. I don't know if it's because of our cultural norms that they couldn't talk about HIV being sexually transmitted. So that conversation ended right there. And I didn't just stop. I was determined to find answers and understand what AIDS really was. So that's how in my 11th grade, I joined the Anti-AIDS Club at my secondary school for me to really understand what AIDS meant. And it is from there that I understood and made a decision that I needed to make sure that I take part in sharing the information about HIV so that no young woman should again die when there's something that could be done about it. From there, I went to university, graduated, and got my first job as a community mobilizer. In this work that I was doing, I was working with teams of mentors that I was managing that we would work together and mobilize adolescent girls and young women in my community and link them to health facilities so that they could access sexual reproductive health services, they could access HIV prevention services. Fast forward to where I am now, working at Corporate Zambia, where we are creating a conducive
most of you are very knowledgeable with what DREAMS is. It's an acronym for Determined, Resilient, Empowered, AIDS-Free, Mentored and Safe Adolescent and Young Girls in all their diversities. And it's quite one of the productive or impactful programs that is being run across African countries. And you can see how Banda has, as a surveillance assistant, has actually translated the impact of assisting adolescent and young girls also within the theme of, say, which we are within today, saying we should mind the gap, empowering adolescents and young girls through health services and engagement. The next presentation will be from Nomonde, and Nomonde Ngema is a young woman living with HIV. She channels her voice to advocate passionately for AGYW, driven by a deep commitment to equip them with the tools needed for self-actualization and positive living experiences. Inspired by her dedication, she have taken up the mantle as a Her Voice Fund ambassador, empowered to make a difference in the lives of vulnerable girls. Her journey involves leveraging social media platforms, particularly TikTok, to raise awareness about young people living with HIV. Through her content, she unpacks crucial and sometimes uncomfortable conversations, providing reliable information to make these experiences more manageable and empowering for adolescent girls and young women. As her audience grows, so does her determination to amplify their voices and advocate for inclusive healthcare, comprehensive education, and meaningful opportunities. Together, through advocacy and awareness, we can foster a community where young women feel supported, informed, and empowered to live to the fullest, regardless of their HIV status. And yeah, I think that is the end of the presentation, the introduction of Nomonde. Her answer to the questions of the panel. As a Her Voice Fund ambassador, I've seen firsthand the critical gaps in institutional services for AGYWs, such as the stark absence of youth-friendly healthcare, inadequate education on sexual and reproductive health rights, and limited economic opportunities that fail to empower us fully. These gaps perpetuate barriers that hinder our ability to access essential services and realize our potential. Reflecting on my experience as a young woman living with HIV, the lack of youth-friendly healthcare stands out as a significant challenge. Many healthcare facilities are not equipped to provide the supportive environment and tailored care that we need. This is not only affecting our physical health, but also our mental and emotional well-being. We deserve healthcare that respects our confidentiality, involves us in decision-making, and understands the unique challenges we face. My call to action is clear. Let's champion tailored services that understand and respect our unique needs, advocate for inclusive policies that amplify our voices, and ensure that adolescent girls and young women are active participants in shaping decisions that impact our lives. Together, we can bridge these gaps and create a future where every AGYW thrives. That is from Nomonde Ngema and Modesto.
Thank you so much, Faith. One of the things I really love about hearing people's personal stories is it's a beautiful reminder that behind the statistics, behind the services, behind the program reports, are young people with lived realities when it comes to the response around HIV and SRHR. And it was also a nice reminder of where I started as well many, many, many years ago, as I was reminded yesterday. And the reason why programming, and particularly programs that seek to fill the gap for adolescent girls and young women, have lifelong impact. They are most often the difference between whether you make it out of childhood, whether you make it out of teenagehood into adulthood, and whether you make it out of adulthood into aging, or as we've now come to know it. Yesterday I was told that I should now identify as a young person living with age. So another new definition, and that I will also adopt. Kimberly, I know I'm going to change things a little bit. I think just for projection, I'll ask that when you respond to your next question, you please come up to the podium. And this is a question for Kimberly. Kimberly, one of the things that you mentioned in your opening speech were the challenges that, as young women, you continue to face. We'd like to hear from you, coming from the Caribbean, What are some of the particular challenges that young women are facing? And what are some of the solutions that you're bringing in the work that you do?
So, thank you very much to me. Y'all can hear me fine now? Okay, great. One of the challenges, well, a number of challenges young women living with HIV, especially young mothers living with HIV, continue to face in the English-speaking Caribbean is the lack of support, the lack of psychosocial support, the lack of mental health support, and just genuinely being able to cope with now, okay, I have this disease I have to live with for the rest of my life, but also I am a young mother, that I have this next human being that I have to take care of. And it's generally that as well, and the lack of community, because living with HIV in the English-speaking Caribbean, because of stigma and discrimination, you're very much isolated. So unless you grew up in an institution, you will have that community. But those who grew up outside or who are HIV positive from outside, and they were not necessarily in the adolescent clinic, but in the general adult clinic, they didn't have that support. And I'm speaking from my experience in that regards. You were by yourself until I only started being involved in a community or having a community and knowing other young people living with HIV is when I started doing advocacy work with TCCW, and I got to travel and meet other young people living with HIV, and I started having conversations. And this is something that I am trying to do really hard for the young people in Trinidad and Tobago, especially the adolescent girls and the young mothers. So that's why I tend to, apart from the general groups we have, I tend to keep them separated, so I know they are easily accessible when needed and when to introduce programs to them. And a major issue that continues to still stands for the English-speaking Caribbean is the lack of funding to do for because the organization I am a part of, it's for women and adolescent girls living with HIV. It's not necessarily a youth-led organization, but it does a lot of youth work. We do a lot of youth work, and when it comes to funding, to getting funding to the English-speaking Caribbean to continuously do projects and to provide the support that these adolescent girls and young women need, it's very much lacking. So people might ask, why not get governmental support? It's not that easy in the Caribbean, and funders and donors are not so much interested in the region. So yet still our region, my region, continues to fall behind when it comes to the HIV response, and now with the dwindling funding, it's even worse for us.
All right, thank you, Mioba. In the same breath, can you please share with us the challenges that you have encountered in your journey, in your advocacy work with adolescent girls and young women?
Thank you so much. There is really so many gaps that we have identified in our advocacy work, in my advocacy work, advocating for services for adolescent girls and young women, advocating for inclusivity as well. But I will just stick to 3 gaps that I have encountered in the implementation and the work that we are doing. I'm going to start with talking about feedback platforms. Many are the times when people that design interventions for adolescent girls and young women do not take into account how they are going to get feedback for the services that are being provided. There are no feedback mechanisms, there are no feedback platforms. We have quite all right designed interventions. To start with, the interventions that we have designed did not include young people to have a voice and speak to what it is that they really want and how they feel comfortable receiving the kind of services that we are providing. Secondly, we do not have the feedback platforms for us to just make sure that the kind of services we are giving are of quality, are what exactly is needed. So that's a very big gap. One thing that we are doing as Corporate Zambia is that we are developing a chat-based feedback mechanism where young people that we link to the health facility can get back to us in real time to say, hey, I went to a health facility to access this service, and I don't think this is what I should receive. So we are getting real-time feedback on the quality of services, on things that can be improved at the health facilities to just make sure that young people are comfortable and look forward to going to the spaces where they're supposed to be accessing these services. Secondly, I'll talk about integration of services. The silos in programming have unfortunately spilled over into service delivery. What I mean by this is we have designed interventions that are sexual reproductive health intervention, and we are providing services for adolescent girls and young women covering that component on one side, while even other interventions from the HIV space are providing services on the other end. The gap here is that an adolescent girl will need to move from point A to go and access sexual reproductive health services, and again move to point B to go and access HIV prevention services. So you find to say that an adolescent girl at the end of the day will only access one service. They'll either go for contraception from one end and not end up reaching where the mobile clinic or where the health facility or where the youth-friendly space is for the other services. We are advocating as young people that we integrate service provision. Why not have a mobile clinic where, as a young person, when I come, I'll be able to get my contraceptives, I'll be able to get an HIV test, I'll be able to get information about abortion services if I need such. So that is the second gap, and we are advocating that can we integrate these services that we are providing for young people. The third gap that I have identified, encountered, even as Corporate Zambia in our implementation of our services and advocacy work is around youth-friendly spaces. We quite all right have youth-friendly spaces in health facilities where young people can go and access services, where young people are supposed to go and access services. The problem with these youth-friendly spaces is that they do not have they have inadequate commodities. So what we'll do in our work is identify young people at risk. Tell them you can go to this health facility, there is a youth-friendly space where you will not need to meet with other people, where services are going to be provided. When we take these young people to the youth-friendly spaces, we do not find the commodities that they are looking for. Remember, we talked about PrEP in our education campaigns, in our information sharing. We talk about PrEP, condoms, HIV testing, and a young person goes to the youth-friendly space and they are unable to find PrEP, which means that the next time we tell them about it, they'll say, I went there, but I didn't access the service. It was not there. So we do have the spaces, but they do not have the commodities. Secondly, when talking about the youth-friendly spaces, another gap within the youth-friendly spaces is that we do not have healthcare providers that work on a rolling basis. So in as much as we create demand for young people, go to the health facility, there's a youth-friendly space, go and access this service. The young people, when they go there, because there's no stationed healthcare provider to be available throughout the day, they may find that there's no healthcare provider to give them an actual service. We have been supporting youth-friendly spaces as corporates by training peer educators who support the provision of services. But the attrition rates for peer educators is very bad. Every year we have to keep retraining. Previously, last year, we trained about 100 peer educators, and as I am talking right now, we have less than half that are available to provide these services. So what we need are healthcare providers that are going to be stationed at the youth-friendly space throughout the day, so that at whatsoever time an adolescent girl or young women will visit the health facility, they should be able to access, to be supported with the services that they want. And we are also advocating for commodities to be available in the spaces. Thank you.
Thank you, Mioba. I think all of us in this room, we can attest to the fact that in as much as AGYWs are not a homogeneous group, but at the end of the day, all the challenges that they kind of face are the same. Lack of youth-friendly services, for an AGYW to access those services, and we know that these are young people who actually don't have jobs, and if you are told that you have to access a contraceptive pill from a clinic which is 11 kilometers away from you, that is not feasible for a young person. And these are some of the things that when I'm looking around the room, I'm seeing some of the people who actually are part of the spaces that are supposed to be the platforms that we leverage to hold space for AGYWs. And we're hoping that as we move into our question and answer, we'll have a very interactive dialogue between all the adolescents and young women allies in this room, and also we'll also have questions that we'll pose to you to ensure that we get a sort of commitment as to how we are going to move forward in terms of what we've collected from this particular session. And at this moment, I want to open the floor to you to ask questions to our panelists. If you have any question, you can ask.
Thank you so much, Yabo. Thank you so much, Kimberly. My name is Olerato, and I'm from Botswana. We also do a lot of programming related to girls and young women. My question for you two, either one of you will answer it, is I see in this space that we're sitting in, just as Faith has said, some people who carry the key decisions to all the answers that you have to say. I'm going to call out one that I see now from our National AIDS and Health Promotion Agency, Mr. Selato. And these are the people who respond to exactly what you've been saying. So my question for you is, in just the spirit of having that representation here, what is the one thing, just the one thing that is top of the priority list for girls and young women, given the challenges that you've just shared now in terms of closing the gap? Just one thing. Thank you so much.
Thanks, Olerato. Can we take 3 questions and then we'll hand it over? Notice.
Yeah, thank you so much for the good work that you're doing. I've got one question for all of you that I've heard a lot of the challenge that you're going through, and the way that you take action to mitigate those challenges that are facing AGYW. But I've never heard you talking about how do you influence decision in your country to make sure that these issues like commodities not being available, health facilities being far from where young people they are living need to be addressed by the government. What do you do to make sure that these young people, the AGYW you are serving, they are in this platform to just inform those decision makers to just critically understand this is what we want and this is what is happening on the ground?
Thank you so much, Cyprian. Resla, do you note it? I'll hand over.
Hi, good morning. My name is Natasha from Zambia. I have a question for Kimberly. And I think you mentioned a lot about the challenges, but I would love to know what are some of the wins that you've seen as far as programming for young mothers. Thank you.
What are some of the wins, Kimberly? Reselato. There was a call to action, to commitment, so we'd like to hear from you.
Well, good morning, everyone. Unfortunately, I've been put on the spot, but I just need to mention this. In our country where I come from, in Botswana, young people are one of the worst affected by HIV, especially young girls. I need to mention this. For all the new infections that occur, you'll find a quarter of them are amongst the young girls. So the government has put in place measures to try and arrest this. And what we are doing currently is we are resourcing the DREAMS program as much as it has been resourced by the US government through PEPFAR and all of that. But we are also putting some money and resources to ensure that young girls are at the center stage. We have also put up many other programs for young people, which we support at government level to ensure that there is that space. We have youth-friendly services which we support with government money. Annually, we provide the money for that. The staff that's hired is at government expense. And we've tried to put as many of such youth-friendly clinics, youth-friendly sites, as many as possible, so that youth are at the center stage. Looking at the results of our recent survey, the HIV population-based survey, which is the FIA equivalent, but we call it the Botswana AIDS Impact Survey, we've realized although prevalence is going down amongst young people, new infections continue to go up. So I think, the future of HIV is arresting, well, the future of elimination of HIV is to really look at young people and eliminate it at younger ages. In terms of PMTCT, we are doing very well. Elimination of mother-to-child transmission of HIV, we are doing very well. So there is no reason why somebody who has been born without HIV from a mother who is living with HIV should pick up HIV at a later stage in life. So if we are to really win the battle against HIV, is to ensure that at youth stage especially, at no point should anybody be picking HIV infection. So we'll be doing that. Thank you.
Rasilato, not to put you on the spot unnecessarily, in 2022, there was a commitment that Botswana will take on READY. It's 2024. I hope in 2026, one of the programs you'll be talking about is the READY program in Botswana. And I'll take the last question and then over to the panel.
Great, thank you, and thanks to me for talking about READY. And first, congratulations to the, I don't know how to say it. How do you say Motswanans in the room, because you got them? Motswana, yes. Thank you so much. I'm really excited first because yesterday when we were doing the opening, we requested that we do not talk to ourselves. And this session is a reflection of the fact that we are not talking to ourselves. So I want to ask a question to the amazing panelists on yesterday during the intergenerational panel. There was a lot of conversation about how young people do not want to collaborate with those living with age. Yeah, they say those living with age. So my question to you is, do you agree that when leading, we do not want to be held? Do we want our hands to be held, or do we want to just lead because we know what's right for us? And the other, and please be very honest. And the other question is in terms of engagement of adolescent boys and young men. And I'm looking at Cyprian for this because I know that that was a question that he was going to bring up. Do you think it's important? Do you think we need them? And all the other youth allies or AGYW allies? Thank you.
Over to you, Kimberly and Mioba.
So I would go first. So to answer the first question, the challenge continue to be, especially for the English-speaking Caribbean, is funding. Make the funding available. A lot of the donors would say they want to work with youth-led organizations, but the reality for the Caribbean is it's easier said than done. It's very hard to mobilize young people living with HIV, to have all of them in one collective space, far less to have a full-fledged organization. So my thing is, make funding available to organizations that do youth work, that are actively participating in the HIV response when it comes to youth. Where's Cyprian? Where did Cyprian go?
He just walked off stage.
To answer Cyprian's question, something I think that has been something that I have been actively working hard at, and this will come into the question you asked where the wins are concerned. I have, with the help of ICW Global, the international community of women living with HIV, they have been helping a lot, especially when it comes to actively having youth participate in the HIV response in the English-speaking Caribbean, but little to no funding, little to no support through the CWAG program, that's the chapter of adolescent girls and young women living with HIV for ICW Global, through their social media team and through several different projects that they have been actively helping and actively being a part of that. Also, when we go locally, so locally, the Trinidad and Tobago Community for Positive Women, they have been running the gender-based violence campaigns and their social medias where actively we get full support and feedback from the general community. So I think that's a good, that counts as a win as well. Also a couple of months ago with ICW Global, a lot of them participated in the obstetric violence and the global scan that happened, which is unheard of because usually they won't participate. And I have, again, with ICW's help, I have been using that as like my base platform to actively have adolescent girls and young women participate in things. So a lot of when the global scan is launched, I'm going to leave that for ICW, a lot of the interviews that were done, and there's a couple quotes from young women living with HIV in the Caribbean. And so I am actively a part of the National HIV and AIDS Policy Steering Committee for Trinidad and Tobago. So I actively got young people living with HIV to participate in the public consultation for that policy as well. So I actively got them to the site where we were doing the consultation and actively had them participate. So I made them go and join different groups and give a full feedback. Also, I think it was last week, or when we did the consultation for the youth declaration, there were active young people in that declaration as well, which did not happen before, because the last one that was done in 2022 in Montreal, young people from the Caribbean did not participate. They were not there. So they were very much present in this one, and they were able to voice a lot of their challenges and a lot of the things that they face. So I count that as a win. And to answer Joyce's question, honestly, yes, in the context of my region, having people with aging be a part of having aging people be a part of having older people be a part of the response, I think it's needed, and it's very much welcomed and wanted, especially for regions like mine, where because of stigma and discrimination, again, we don't have youth-led organizations, but there are grassroots organizations like women-led organizations that are actively involved. So providing them with the support and actually investing in the programs and looking at the programs that they are available really helps, and it really goes a long way. So, but then when we look at the not so good side, it can be because a lot of the times young people can feel tokenistic, and the older people that are heads of the organization could sometimes steer the young people towards what their cause is, and it may not necessarily align with what young people need or what young people want. So it can go both ways.
Thank you. And over to you, Miova.
Thank you so much. I'll start with a question from Cyprian about what we are doing when we find that these spaces while we are referring young people do not have commodities. So to start with, in my earlier points, I had mentioned about the feedback platform that we are working on as corporates, where young people give real-time feedback about the kind of services that they found wherever we referred them to access the service. So once we get that feedback, we now start our advocacy campaigns, having meetings with civic leaders to explain to them and also just show them the importance of having commodities at youth-friendly spaces. Also, as young people at Corporos, we are also developing police briefs based on the feedback that we have obtained from the young people that we are working with and supporting. So we continue developing documents, police briefs, we do operational assessments. We also continue with our advocacy meetings with stakeholders, with government officials, with community leaders, and every other civic leader that is important for making decisions that are going to make sure that we benefit as young people. When it comes to us working with working with young people, people that identify as young, but I don't even know, I can't even remember how we are calling them. I'm going to marry that question while answering the first question that we were asked to say, since we have decision makers in this room, what is our ask? We have no problem working with people of age, older people, because we also want to make sure that we get the support from them. But what we really want is, can you give young people time to make sure that they lead in implementing these interventions that we are designed for us? Could we be the one that are leading the implementation? So that also answers the question to say, my ask really is, can we have more opportunities or support, especially with funding, to interventions that are being done by young people, because we understand fellow young people. We know how to talk to ourselves. We know how to make sure that we get what is needed for young people to freely receive the services. So our ask is that we need more funding, especially for young people to do the kind of work that we are doing, because we understand the needs better. And we still need other people to keep supporting us in this. I hope I have answered all the three questions. Thank you.
Okay, thank you so much, Mioba. I'll take one last question as we need to wrap up in the next 3 minutes.
Thank you very much, the presenters. I'm Shamina Kauma from the Ministry of Health, Uganda. I work with young people and adolescents. Unfortunately, in our country, Uganda, teenage pregnancy is too high, too high. Using the indicators that we are released after 5 years, in 2016, we had 25% of teenage pregnancy. After 5 years, in 2022, teenage pregnancy reduced to 24%, which means there was only 1% change, you know? But again, we have also high numbers of people, younger people and adolescents that are getting HIV because of having unprotected sex, yeah? Unfortunately, for us in our country, immediately you realize that you are pregnant, you're supposed to seek for antenatal care services. This is where a person can get services of checking your HIV status so that they can help you and your unborn baby, okay? Immediately, these adolescents are checked, or before checking, they are supposed to go with their boyfriend or the husband. And in most cases, they don't do this. And when you don't go with the husband or the boyfriend, then the government is like, doesn't want to check, because they want to know and also to give results for both of you to understand the status. And but at the end, if you don't produce a husband, they will go and check you. The bad thing is that after understanding that this adolescent or the young child, the young person is positive, they don't turn up for services. They hide, and it worsens the situation. I don't know how these young people can be helped. You have just indicated that you are trying as adolescents and younger people to interact with old people. In our country, yeah, it's like the way you have said, young people don't want to interact with the old people, and that's one of the things that is making them not to come for services. How can they be of hope? Thank you.
Very much. Thank you. Thank you to everyone for your questions and your comments. As we wrap up, Faith, I'd like to ask the panelists to just close off with your biggest call to action, and also to thank the audience that stayed with us for this session. Over to you, Mioba, and then Kimberly.
Thank you so much. So, I would strongly recommend that in Uganda you also strengthen the youth-friendly spaces, and also maybe focus on doing advocacy work to just see how best the young people can be supported or helped to make sure that they turn up for antenatal services. it is very important that they show up. And probably what you should start thinking of is what kind of advocacy campaign can you start running to just make sure that young people now can start showing up for services. And my call to action right now is, can we engage men also as we are talking about adolescent girls and young women? We have empowered women. We have empowered women to the extent that they understand these services. I would like to share a very short story to me about when we did education campaigns at a certain university in Zambia called Copperbelt University, and we had this 21-year-old girl who came to access PrEP services. The following day, we were being called by the healthcare providers to say she returned the PrEP that she had gotten because the sexual partner did not approve. Imagine if we had done this together with a sexual partner, they would have supported her in taking that decision. Can we get to a point that as we are doing adolescent girls and young women's work, we engage the sexual partners? After all, these are the people that the adolescent girls and young women are having sex with. So they should be able to understand what is required of an adolescent girl or a young woman so that they can fully support us.
Thank you, Mioba. Thank you so much. Over to you, Kimberly.
For me, for the English-speaking Caribbean, I want to say core funding. And when it comes to accessing sexual and reproductive healthcare services, relooking at the age of consent, because a lot of the times, those under the age of 18, because legally in my country, you have to be 18 years and over to access sexual and reproductive health rights and services. But you need to have parental consent if you're younger. So I think wavering that and looking at decreasing the age of consent where a young person can go and access sexual and reproductive health services is very important. And I would like to say, when it comes to GBV and a lot of all the issues that adolescent girls and young women face, especially when it comes to gender-based violence and domestic violence and all the different types that affect adolescent girls and young women, we need men and boys to be a part as well, because we can educate the adolescent girls and young women, but what are we doing to educate the young men and boys as well? So I think that is very important. And to close off, I know I'm going to say this and I'm going to be repetitive, but outside sub-Saharan Africa, the Caribbean continues to be one of the regions that have a lot of, our numbers are high but not high enough because we are small populated islands. So we are second when it comes to teenage pregnancies, when it comes to new HIV infections amongst adolescents, not just adolescent girls and young women, but adolescents in general and young people in general. But because we are small countries with small populations and we are classed as high-income countries because of many of our islands have tourism, so we don't access funding that is there and that are available. So I'm asking for the people in the room to redirect funding to the Caribbean, because we needed the grassroots organizations that are doing so much with so little can do way more once the support is there and the funding is there for them to continue doing the work that they have already been doing.
Thank you so much, Kimberly, and thank you to the lovely audience. We'd like to also thank the Munich Youth Force for organizing this space. Thank you so much.
down. Feel free to take a notebook and a pen and sit down. Hi. Hi, everyone. We are just about to start, so if you can sit on the seats here, that will be helpful. But if you can hear from wherever you are, that is cool too. Hi. 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 Hi, everyone. Welcome to this session, a short session on self-care. We thought it was important for us to learn a few tips or remind ourselves of a few tips on how to take care of ourselves as we advocate for the communities that we advocate for, especially for the community that I represent, and that is young people living with HIV. So a bit on self-care and what self-care means. According to the WHO, self-care is the ability of individuals and communities to take care of their own health, promote their health, seek treatment, treat themselves without necessarily seeking direct support from healthcare providers. What this basically means is that young people or people in general have the ability to take care of their own health and promote their well-being without needing to seek professional healthcare services. So I will like to highlight a bit on the pillars of self-care. As you can see on the screen, there is a self-care wheel that highlights a few of the pillars of self-care. One of the pillars of self-care is knowledge and health literacy, which means the capacity for individuals to comprehend their well-being, more precisely understanding their rights and knowing what they need to do in relation to sexual health and rights. So this means educating yourself as an individual on what you need to seek, what works for your body, what doesn't work for your body, and making sure that you apply this in your day-to-day life, especially as an advocate for this context. The other pillar that I wanted to highlight, and one that I am a strong advocate for, is mental well-being. Mental well-being includes self-awareness and the aspect of urgency in optimizing or seeking for mental health care and taking care of one's mental health space. It has components of self-esteem and life satisfaction, meaning that as young people, self-awareness and knowing what is too much in regards to mental health or taking care of your mental health space is really important in holding space for yourself and holding space for the community you represent as well. I would also like to touch on the physical activity, which, as we all know, is a physical movement. But physical activity in this sense refers to physical movement that requires energy expenditure, meaning that as we move, our minds are active as well, and we are able to be in a safe space mentally. I'd also like to touch a bit on healthy living and healthy eating. I think that this is something that seems common and looks like we have figured out, but it is not really just eating for the sake of having a balanced diet, but really knowing what is good for your body, knowing what works for your body. As a young person who is under therapy, knowing what works for you and taking food that allows you to live healthily. I would also like to speak about risk avoidance and mitigation. This means avoiding everything that would potentially cause harm or risk to your health or risk to your body, and this has an effect on the mental health space. I would like to touch a bit first on my presentation and allow you to present or to share a few aspects on how you take care of your mental health or self-care. So yeah, I will have the mic passing around so that you also share as the audience. Finally, I would like to touch on rational and responsible use of products, services, and diagnostics, which is mostly what self-care in the health sense means. Meaning that, next slide, please. So I have highlighted a couple of resources. This is not everything, but these are resources that I think are useful as young people who take care of themselves, or young people living with HIV, or advocates for young people living with HIV. And one of the resources is the WHO guideline on self-care, which is a guideline that highlights different components on what self-care looks like for young people especially. The WHO guideline has been repackaged into simpler versions, which is available in the Y Plus Global website, so feel free to visit it and learn more on what the self-care interventions for health look like. And this involves aspects like self-test, aspects like safe abortion and what that looks like for individuals, so feel free to explore that. The other toolkit that is really important as young people and as advocates in the space is the self-care toolkit on SRHR and HIV for young people. This is a toolkit that was developed by the Youth Care Project under the support of AIDS funds. And this toolkit was developed by young people in Kenya, Tanzania, and Zambia, and it contains different components on self-care, including mental health and knowledge, access to knowledge on SRHR. So also visit the Y Plus Global website and you'll be able to access that. Before we play a video that I would like for us to all watch and see, I would just like a few of us to share on what self-care looks like to them, especially on the mental health side. Any takers? I'll give free notebooks. They're not mine, but I'll give.
Great, thank you very much, Ivy, and great talk on self-care. For me, I think self-care is very important to myself as a young advocate and as one who boldly advocates for others. So as you are just speaking now, I remember that we have a wellness center right at the back for young people in all our diversity to go take a space and just chill and breathe. And many times we forget the essence of just taking a chill pill to breathe. Someone told me once that we are not saving lives, we are just saving PDFs. And I think that has been the greatest advice to me as a young person who used to glorify overworking and all that. And now when I feel like it's getting a little too much, I chill, I take a break, and I get some breathers. So yeah, thanks.
Thank you so much, Joyce. Joyce has raised a very important point on taking a break. And we can only advocate for others, and we can only be at our full self. I mean, we can only be there for others if we are at our full self, and we are able to recharge by just taking a break. You are not saving lives, you are saving PDFs. Remember that from Joyce. Yes, I'm coming to you.
Hi, everyone. My name is Charles. I will request to stay seated. Is that okay? For self-care, for me personally, I feel like you cannot pour from an empty cup. So you have to fill your cup first before you're able to fill the other person. So even when it is just emotional support and things like that, you're only able to do that when you're at your full self, as you have mentioned it. So for me, if it means delegating, working as a team, and not just taking the whole heavy workload by all yourself, because sometimes some of us are perfectionists and you feel like no one can do the work as you're going to do it, but sometimes you can mentor someone or a group of people and the results will be very, very remarkable. So as self-care for me, I feel like sometimes it is seeking for support where you need it and not just carrying the whole heavy laden baggage for yourself alone. Yeah, that's it for me.
Thank you so much. Your name?
Sorry, my name is Charles Nabulia. I come from Uganda. Yeah.
Thank you, Charles. Charles also emphasized the importance of allowing others to hold space for you. Delegate if that work can be done by someone else. If you are not a doctor, that work can definitely be done by someone else, so delegate.
Hi, everyone. My name is Maxwell from Zimbabwe. For self-care, while you were talking, I remember while in the plane, they were talking about oxygen masks. In case of an emergency, there will be an oxygen mask, and they emphasized the importance of us, putting your mask first before you help someone. So there's great need for you to help yourself first before you help someone. And I also think for us, most of us, we are working and at work, we have spaces where we talk about self-care and so forth. But you are thinking of young people who are at universities, colleges, young people living with HIV, young people who can't even have someone to talk to about those issues. I think it's great need for us to remind those kind of young people the pressures they have in life, balancing jobs, balancing work, everything that comes to them. A lot of pressure that's mounting on them. So I think as partners, as young people, we need to encourage each other onto taking care of themselves. They don't have someone to remind them, and I feel like it's our job as well to remind young people that they should take a chill pill, relax a bit, take care of themselves. I think that's very important as well. Yeah.
Thank you so much, Maxwell. And as Maxwell was speaking, I was just reminded of one important thing that we forget as mostly people of color, and that is glorifying labor. Labor is not glorified. You can relax and still get the work done. So as Maxwell has said, fix your own oxygen mask first before you fix someone else's, and also let's normalize conversations on self-care and mental health with the populations that we represent or the populations that we are part of. Yes, I think this will be, no, you had your hand up, so I think you'll be last. Okay.
Okay, thank you very much, moderator. I'm Shamina Kauma from Ministry of Health, Uganda. You're welcome, my brother. In Uganda, the Ministry of Health, we are commemorating a self-care month, and July is a month for self-care. We create awareness. For us, the adolescents and younger people, they use social media a lot. So we develop messages, send them on social media. We get also images or photos of outstanding younger persons to use a message. We tag a message to the photo of that person so that, this is Uganda, so that these people, when others see the photo and someone is talking, for example, about family planning, yes, they attach the message to themselves. Because, younger people, like I said in the first session, younger people in our country, they don't want to associate with older people. They think we are too old, we do things which are outdated. So the ministry came up with this month to commemorate self-care. And the National Day event is going to take place on 24th this month in one of the districts. And the guest of honor will be Minister for Health. Yes, thank you very much. Just wanted to share that with the team.
Thank you, Shamina. And it's actually the world is commemorating Self-Care Month. And this was our way of also participating in the same as well. So this is us just plugging into the Self-Care Month. We also had a couple of activities going on during Self-Care Month, including use of social media, which is a big tool. And young people relate more to infographics on social media. So the WHO guidelines, the self-care toolkits, they have all been converted into forms that relate to young people. So good work in Uganda as well. Finally, Cyprian.
I think I'm preempted, but doesn't you have preempted all of that we have contributed. But I would like to just bring relation to what I heard yesterday and what I'm hearing today about the self-care, despite of the work that I'm doing in my country. Is this that yesterday I heard from the older generation during the intergenerational dialogy that they used to work so hard. They used to be in a team that they used to call no sleep team, for them to just deliver the program to make sure that people today that like we are able to meet, discuss and so whatever. But they emphasized saying that it is now very important not to focus on what they used to do in those era. They emphasize making sure that us as young people, we should get a time to just think of ourselves too. We should not go back to where they used to work of no sleep, be like them, no sleep team. We should have enough time for us to just think on what matter most for ourselves and then make sure that we work on those things that matter most for ourselves and take time for our health, take time for our personal issues so that we are able to deliver on those programs that we are working on. So I just wanted to put an emphasis on only that.
Thank you, Cyprian. That was a good way to end the reflection session with just reminding us to take care of ourselves, self-care, meaningful engagement of self. So for this, I would like for us to watch a video. So yeah, this is a video that is based on the self-care toolkit for young people living with HIV. Yes. Enjoy.
Welcome to our self-care adventure. In this animated video, we will explore practical self-care strategies inspired by WHO guidelines. Whether you're a young hero or a seasoned pro, these tips are for everyone. Self-care is about taking intentional steps to maintain our physical, mental, and emotional well-being. It's not selfish, it's essential. Self-care can be defined in various ways. The WHO defines it as the ability of individuals, families, and communities to promote their own health, prevent disease, maintain health, and cope with illness and disability with or without the support of a health worker. Would you like to discover how this applies to you as a young person? This video will give you practical tips on how to take charge of your sexual reproductive health, particularly in accessing sexual reproductive health services. Sounds fun, right?
Did you know you can practice self-care literally anywhere? At home, at school, at work, or even on a bus. Let's see how young people practice healthcare from where they are. The first self-care practice is self-management, which includes practices like self-examination and self-administration. When you think about self-examination, what comes to mind? Self-examination is when you check your own body for signs of illness or disease. Self-exams can help detect a variety of health issues, including cancer, heart disease, and diabetes. For example, a breast self-examination can help you detect any abnormalities or lumps within your breasts. This is something anyone can practice on a daily basis and stay healthy. Another form of self-management practice is self-administration. Would you like to access sexual reproductive health services without needing a healthcare provider's involvement? If so, self-administration might be a good option for you. Self-administration means giving yourself medication as prescribed by a professional, such as self-administering contraceptives. However, it's important to consult your healthcare provider to determine the appropriate medication and the best option for you.
Are we ready for the next step in our self-care journey? Let us talk about self-testing and self-sampling. Do you want to get tested for HIV but are unsure if you would want that done by someone else? Self-testing may be for you. Visit your nearest pharmacy and see if they have an HIV self-testing kit. If they do, those kits would normally provide instructions on how to use them. Simply read the instructions, prick your finger and wait for your results. You can then plan better for your health based on what the results are. That doesn't sound so hard, right? Alternatively, are you tired of waiting in line at the hospital just to get your sample taken? Self-sampling might be an option for you. After consulting with your healthcare provider, you can obtain a kit, collect your own samples, and send them to a lab. The lab will test the samples and share the results with you, just by collecting
for a pregnancy test. Remember to consult with your healthcare provider to learn about your options.
In this next part, we are going to explore
Pregnancy
self-awareness as a form of self-care.
test.
So far, you have probably heard
Remember-
this word a lot. Self-awareness. Let's break it down for you and let you know how important it
So-
is. There are many ways to promote
with your healthcare provider to learn about your
self-care.
options.
Word on it. First of all, have you ever wondered how people know so much about their own health? Here's a tip: education. It's important to research and acquire the right information and knowledge on health issues that matter to you. Knowledge is key, and knowledge is power. And now, what does this knowledge help to achieve? It helps with building your confidence. Did you know that believing in yourself and your abilities is an important self-care practice? Well, now you know. In addition to general health knowledge, knowledge of sexual and health and rights is equally important.
Reproductive
developing self-awareness. What do we mean by
health and
this?
rights is
When you are
equally
empowered with SRHR information, you can confidently
important in
negotiate safer sex and reduce the risks of
developing
HIV,
self-awareness.
unintended pregnancies, and STIs. In conclusion,
Awareness.
self-awareness encourages
What do
you
we
to make
mean by
choices
this?
and manage
When you
your
are
own life.
empowered with
This
SRHR
includes achieving
information,
bodily
you can
autonomy and
confidently
integrity,
negotiate disease
such as
and
choosing to
STIs.
abstain from
In
sex if it
conclusion,
feels right for
self-awareness
you.
encourages
It's
you to
your
make
life,
choices
your
and manage
choice.
your own, such as choosing to abstain from sex if it feels right for you. It is your life, your choice.
For all young people looking to adopt self-care practices,
If you're interested in learning more and being
it's
empowered to take care of yourself,
important to remember
the
that self-care
Toolkit,
is
which
not a
can be found
luxury.
on Y+
It's
Global's website and offers practical tips, resources, and personalized
necessity.
plans. Feel free to download it and check it out.
If you're interested in learning more and being empowered to take care of yourself, the Self-Care Toolkit, which can be found on Y+ Global's website and offers
Remember that
practical
self-care
tips,
is not
resources,
selfish, it is essential. Thank you.
Can you hear me okay? Great. Hi everyone, the session's about to begin. If you can please take your seats. I'm good to go? Okay, hello everyone, welcome. I am so happy to be here to officially launch the Youth Next Level, the resource that we've been developing for the past 2 years. Thank you to everyone who's able to join us. Before we begin, I want to give a brief rundown of the session. You'll hear from our 4 speakers today. So unfortunately, one of our speakers were unable to make it because of the flight cancellations over the past weekend. We'll have the opportunity to hear from you in the audience as well, and we wish to hear what you are most excited about for the guidance. Towards the end, we will share a QR code with you so you can actually download and see it online. Youth Next Level is a core piece of guidance that's been developed by UNAIDS and Y+ Global to support sustainable youth-led responses as part of the urgent course correction needed to meet the 2030 goals. Earlier today, we heard from many speakers about the actions that we need to take to end AIDS by 2030. However, in the report, we've also seen some cause for hope. We have heard how young people and faith leaders are coming together in countries like Nigeria to improve the health of adolescents and youth, and how innovations and gamifications have reached 300,000 young people in Cote d'Ivoire. Networks are also in the middle of completing the Uproot scorecard, another way that UNAIDS is partnering with youth-led organizations to monitor the HIV response for young people. There are also causes for concerns. In my own region of Asia Pacific, the new report shows that young key populations continue to face stigma, discrimination, and a lack of access to adequate services. 49% of new infections in Indonesia in 2023 were amongst young people aged 15 to 24. Something needs to be done to change this. We know that there is a wide variety of resources out there to support youth-led organizations to undertake the work that they need to support their communities. With Youth Next Level, we are specifically aiming to support other stakeholders and to incorporate youth-led responses into their work. The guidance aims to further support UN agencies, ministries of health, education, youth, and large NGOs to ethically and meaningfully engage young people in their leadership and not just in their engagement. We want this guidance to be used by you as a resource to showcase the best practices to those who you work with. I do want to give special recognition to a few people here and who are watching online. Linnea Renton and Mildred Thabang, the lead consultants on this project, who were instrumental in the development of the resource. Gareth Jones, Alicia Sanchez from UNAIDS, without their leadership and their continued support, we would never have been able to accomplish this. It's because of your continued support that we were able to do this. And lastly, to all the young people and stakeholders involved in the development of the resource, your feedback and your inputs have been instrumental in the design. And now we're just going to open the floor to see whether or not anybody has expectations or if they have any questions about the resource. If somebody from the AV team can pull up the slide, Mentimeter. Okay. Cool. So yeah, I think everybody knows how to use Mentimeter, right? You just open up your camera and scan the QR code and let us know what you're excited about for the Youth Next Level. I'll just give people a couple of minutes to put this on your screens, and you can write down your responses as we hear from the panelists throughout the session. I would like to kindly invite all the panelists to the stage, please. Tiffany, Ika, Maxi, Clayton. Hello? Okay, you can hear me okay? Yes? Okay, so without further ado, we're going to hear from our panelists. I'll start off with Maxi, my boss. Hi. Maximina is the Executive Director of Y+ Global. She's an established HIV and human rights practitioner, advocate, and young woman leader. Maximina became the Executive Director of Y+ Global, the global network of young people living with HIV, in 2024. Prior to this, she was the Her Voice Fund coordinator, working with 125 community-based organizations, serving or leading adolescent girls and young women across 13 countries in Africa. She's an experienced and passionate leader with over 8 years of experience in health programming. Maximina, I know we've been working on this resource now for the past 2 years, but I would love to know, and I would like everyone else to know, what kind of role did Youth Lead and Y+ and all the other youth-led organizations play in the design of this resource?
Can I stand up? I think, thank you so much. Hi, everyone. Hello. Are we in the room? Yes, this is important space for us. So thank you so much, Eddie, for the question. And thank you so much for the support that we did receive from UNAIDS to be able to develop this guidance. I think for me, what resonates with this guidance is that a lot of times we talk about what is engagement and meaningful participation of young people, right? And we've been advocating for this for policymakers, for key stakeholders to be able to really give us the space that we need at the end of the day. But the missing question that has always been is, how do we do that? How are these key stakeholders know how to engage young people? And for me, this youth-led and next-level guidance is a testament and is an answer to some of the interventions and strategies that we need to start implementing at the end of the day. So when we're given an opportunity to be in partnership with UNAIDS to really think through what does it look like and how are we going to engage youth-led organization, young people themselves, informing the guidance at the end of the day, it was an opportunity for us, one, for collaboration, for partnership, for us to create this movement at the end of the day to work together across the regions. We recognize that we're also sitting at the global level. How do we become more intentional and go on the ground to really engage youth-led networks in countries where these issues are happening at the end of the day? So we really came together as youth-led networks, like Eddie was mentioning. Youth Lead was part of it, amongst more youth-led that were engaged in these processes. We started off by desk review to then understand what are different interventions that are there that are speaking, supporting, and engaging young people, first of all, but what does it look like when you talk about what is youth-led? And I just want to pose a question, because I think we talk a little bit about youth-led responses, but most of the times we don't unpack how and what does it entail at the end of the day. So 2 people to tell me, what is youth-led intervention or a youth-led response? 2 people, who wants to try? What is it? Because it doesn't help us to launch this guidance if we don't know what is youth-led response. Who wants to go, or should I just nominate? Yes. Awesome. I've got 2 people already.
I think when we talk about youth-led, it's about young people, according to the WHO definition, 10 to 24 years, who are coming up with initiatives that are from their community, being informed by the issues in their community, and also designing the program by the youth in that community.
Take note, she said 24 years.
Hello, everyone. Good afternoon. I'm Carl from the Philippines YPIR. For me, youth-led intervention, it means youth is in the forefront of the intervention in all levels, in all stages, not only on the designing, but in terms of implementing, monitoring, and all of the stages of projects, programs, and interventions. Young people are on the lead of it.
So definitely, thank you so much, guys, for really providing your answers. Let's clap hands for them. This is what meaningful participation is. So they really rightly said it. Youth-led responses, it means these are interventions, ideas, activities that are being led by youth themselves, for youth, and everything that we have to do is by youth. And when we talk about the issues of age, I know there's a bit of a debate there, but what we've managed to even put in the guidance is to make sure that we are very explicit about it and be able to define what is a youth-led response, which also speaks about age being 30 years and below. So that's the good factor that we have in the guidance that we need to take cognizance of, that we can call this intervention or this activity being a youth-led organization. So what we then went on is we did the desk reviews, we did the key informant interviews with young people themselves in our diversities. We were very mindful in terms of whose voices is going to be in the guidance. After the interviews, we then formulate what you call a validated response and also the mechanism for different key stakeholders to also kind of engage in the guidance. We are talking about UNAIDS country offices, ministries also inputting into that, civil society also contributing, and also some of the youth-led networks to also come in and be able to validate that. Is this exactly what you are talking about when you're saying how are the key stakeholders going to engage the young people on the ground? I think this is some of the things that we did. After the validation, we went on to then to say, now we have the guideline that is talking about everything. And what I love about the guideline is that it has got the practicality of it. If the government or the key stakeholder or the civil society doesn't really understand what is a youth-led organization, they always have a checklist to, okay, it's a youth-led organization led by at least 90% or 80% young people. Then if not, that's not a youth-led response at the end of the day. We need to be very intentional about it. What about the governance? A lot of times when I go on the ground in the communities, the governance, which is the board, mostly is led by older people who can attest to this at the moment. And what exactly are we then saying? So this is what some of the answers that are in the guidance that we've developed to really guide key stakeholders, civil societies, and us as youth-led networks to say, when you're developing your governance, how should it look like? When you're having an intervention, who is leading this intervention at the end of the day? We need to be very ethical in terms of engagement of young people. So that's what the guidance is talking about. So it's no longer a guessing game for a government to say, when we invite young people, who exactly are we inviting? It's no longer a guessing game when key donors come in and want to invest, to say, okay, we want to invest in young people's organizations, and this organization just comes and like, oh yeah, we do work with young people. Exactly. At what level are we saying you're working with young people? And it has to be having a definition. So this is what the guidance is talking about. So we went further then to say, now we have the guidance, which we have all seen and it's being launched. What about its implementation? A lot of times we develop these wonderful tools, guidance, tools in terms of advocacy, but a lot of times we don't implement this guidance. So what we went further is to then further develop what you call an implementation strategy. How are the countries going to start to roll out the strategy itself? Because it's not for us to sit with and to look about and just to say, oh, we developed this wonderful tool. How are we going to measure that the actual work is happening on the ground? So on top of the guidance, you find that there is also an implementation strategy, for example, for UNAIDS country office to actually adapt and say, hey, key stakeholders, civil society, here is the guidance. How can we come together and how can we meaningfully and make sure that the youth-led responses are very sustainable in a way? Not just engaging us today, tomorrow you leave us. You jump to the next, you leave us. What about sustainability? What about engaging us in long term? What does it look like? So this is the process that went into this process. I know I'm taking much of my time, but I'm about to finish. And I just want to really emphasize on the key point around collaboration. For me, I take it because it brings everyone together. It doesn't separate movements. It doesn't separate priorities. There's this issue where we want to put ourselves in boxes, where we say, oh, yeah, we are young people living with HIV, we are young women, then we put ourselves in this box. Then we come and they say, another group comes up again and say, we are this and we are moving with this direction. It's high time we come together and have one agenda. The more we become divided, the more the other world is winning. So that's why I said, through this youth-led next level, I love the name actually, it's called Youth Next Level. What exactly are we going to implement from now until 2030? Whose voice are we going to champion? And how are we going to make sure that the key stakeholders, the civil societies, the donors know about the guidance and follow the guidance and be able to hold them accountable in terms of engaging us? Now they have a roadmap. Now they have a guidance on how to do it. Because previously they've been saying, oh, we don't know how to do it, show us. Now it is there. How are they going to implement it? Is our narrative as young people going to change, or we are going to remain in the same narrative of not being able to be engaged, or any sustainable, interventions not reaching us at the end of the day? I invite you, download the guidance, read about it, share as widely as you can, and thank you so much for being here. Over to you, Ed.
Thank you, Maxi, for walking us through the entire process. It was years in the making, by the way, guys. This took a lot of validation and consultation. So just bear in mind that we worked really hard to unpack what sustainable youth-led responses mean. There is a slide with a QR code, if you can display that, so people can scan it and actually access the resource itself. Great, thank you. So next, we will hear from Tiffany Eheme. I hope I got that right. Tiffany is a first-generation American, Ghanaian, Nigerian roots, was born and raised in Virginia. She graduated from Virginia Commonwealth University with a degree in political science. Tiffany now serves as a program support officer and youth advisor at the U.S. Department of State's Bureau of Global Health Security and Diplomacy, that's a mouthful, which oversees PEPFAR. Her work supports the Office of the Health Diplomacy, the Office of Partnerships, and the Office of Program Quality, which is also a mouthful, leading PEPFAR's new youth initiative. Tiffany, my question to you is, we are seeing an increasing interest in the recognition and the role of youth in the HIV response. Could you share with us some of your reflections on the key role youth play in the global response?
Sure. Can you guys hear me? Okay, great. Thank you, Eddie. And thank you so much, Maxi, for all of your previous comments. A little bit louder. I think you guys can hear me now? Alrighty. Hello, everyone. I'll try my best to match the energy from all of the sessions that have been going on since the Youth Pavilion opened on Sunday. I enjoyed it so much. First, I'd like to say a heartfelt thanks for me and the PEPFAR family for inviting us here today, inviting us to participate, and also for all of the hard work that you guys have put into this collaboration for Youth Next Level resource. This resource is so essential to our collective journey. So, Youth Next Level and similar resources crafted by youth make our lives at PEPFAR and other large global funders much easier. These resources are critical for strengthening sustainable youth-led HIV responses, which are vital if we want the next generation to continue the fight against HIV/AIDS. Youth play a monumental role in the global HIV/AIDS response. They are not just the future, they are the present. A question we often find ourselves asking at PEPFAR is, how do we ensure youth are effectively reached? The answer is simple, and we've heard you all very, very clearly. The answer is to involve youth at every step. All of our efforts, from creating programs to hosting conferences and holding meetings, are meaningless if we fail to empower young leaders. Their unique perspectives and innovative approaches are what drive impactful change. Since the 80s, we've made significant strides in combating HIV/AIDS. However, to continue the progress, we must target priority populations like youth. For instance, on Sunday at the Youth Pre-Conference, I heard Magia, a youth advocate, share her experience about her involvement in the ballroom scene. An experience I've heard about by watching Pose on Netflix, but this is her lived experience. Magia uses her platform and relationship with her community to educate and share resources on HIV and sexual and reproductive health information. So intervention like Magia's can only be scaled and reach more youth if young people in all their diversity play a central role in the global HIV response. Yesterday, I also saw a young influencer who makes TikToks about their experience living with HIV/AIDS. She also educates her peers using a medium that youth connect with daily. At PEPFAR, we are committed to amplifying youth voices in the HIV/AIDS response. We recognize that meaningful youth engagement is a deliberate and essential process. PEPFAR is deliberately working on our youth engagement efforts. We are dedicated and mobilizing as a key partner in the global initiative to end HIV/AIDS as a public health threat by 2030. In February, we hosted a youth special session in Cape Town, where we announced a $20 million initiative to address HIV/AIDS among youth. The initiative focuses on strengthening youth-focused HIV leadership, promoting innovation in HIV prevention, case finding, and treatment outcomes in PEPFAR-supported countries. Recognizing young people's contributions towards attaining the 95-95-95 targets by 2030. One overarching objective we have is to promote youth leadership in the global HIV/AIDS response. Since its inception, PEPFAR has been dedicated to reaching youth, evident in our successful DREAMS program and countless country-initiated youth programs that utilize youth leadership. What's truly transformative about what we want to do now is that our current approach is to focus on empowering this generation to lead their own HIV/AIDS response, with PEPFAR serving as an active partner, amplifying their voices. I'd like to end by saying, let's all continue to support and uplift young leaders, ensuring they're treated as partners, while also ensuring that they have the tools, platforms, and opportunities to drive the global HIV response forward. Let's also utilize resources like Youth Next Level to engage and support their leadership in the right way, their way. Thank you.
Thank you, Tiffany, for sharing your reflections. We hope this is the first step of many to strengthening youth-led responses and the engagement that we have with our donors. And now we'll hear from Ika Novianti, the Regional Coordinator of Youth Lead, the Asia-Pacific Network of Young Key Populations. Ika has held the Regional Coordinator position since 2022. She joined Youth Lead back in 2018. We both joined in 2018, so we're very good friends. She has extensive experience with the Global Fund and was the youth advisor for the Point 7 constituency. Currently, she represents YKPs in Asia and the Pacific in many platforms and leads the network on countless of initiatives on community-led monitoring, Global Fund engagement, network strengthening, mental health, access to services, and many more. So Ika, could you tell us a little bit about the role that regional networks play in youth-led responses?
First of all, thank you so much, Y Plus Global, for inviting me to speak on behalf of Youth Lead and also from the ASEAN Pacific region. So the role of the regional network that we've seen is, the regional network is a bridge from the global level stakeholder to the local level youth-led organization. So what we have doing in the Youth Lead as the regional network is, one is to support the 95-95-95 target for the ending the HIV. What we do, as Eddie mentioned in the beginning, our region is a bit concerning right now because the 25% of new HIV prevalence is come among young people, especially young key population. So what we do to support this issue or to raise awareness for the young key population. One is capacity building for our key population or young key population in the region. So in last year, we've been revising our Tingent manual. It's a leadership manual for adolescent key population so that they are aware about the leadership role that they can take in the national level and also to give awareness for adolescent and young key population to access the HIV services. Other than that, we not only want to build the capacity for the community, but we also did the healthcare worker sensitization training in support of the UNAIDS RST. We've been expanding our training in 2 countries last year. So in the total, we have been doing this in 4 countries. Name it PNG, Indonesia, Philippines, we have our partner here, and also Cambodia. We train over than 200 healthcare provider that they can sensitize the way that they're serving the adolescent and also young key population so that they can do better in the healthcare provider. And also they need to know this is why the young key population and also adolescent, they don't want to seek the health services in the region, right? That's from the capacity building. Now, how many of you as a youth-led organization have been doing monitoring in HIV services? Anyone? Can I see hand? Only Nana? Anyone else? So if you hear about the community-led monitoring, it's been like happening since 2 years back, right? But then the youth-led organization tend not to be engaged in this one. So in support from the UNS again, and Seven Alliance, we have the consortium of the regional network in Asia Pacific. We developed the CLM guideline for the youth-led organization so that they aware about this process and they need to engage in this process as well. So with this manual, we have been doing piloting this manual in 2 countries. One is Mongolia, and last month we did in Indonesia. So from these 2 training, we have we inviting the other stakeholder who has been doing the CLM, the current CLM, so that they can engage youth-led organization as well during the implementation process. And also they can put some youth indicator in the CLM tools, right? Other than that, together with Y Plus Global, Youth Rise, and also Y-Peer, we have consortium from the RCF. We've been getting like funding. From those funding, we also give small amount of money to our country partners so that they can sustain their work. Because the youth-led organization in country level, they often not get the funding because the registration, they're youth-led. So the donor said, like the youth-led organization, they cannot run the proposal or the grant management, something like that. So yeah, that's what we have been doing.
Thank you, Ika, for highlighting the crucial work. You spoke about 2 things. You talk about CLM, which is the work that you're currently doing with UNAIDS, and then you highlighted the work on sensitization of healthcare workers, which is also the work with UNAIDS. And speaking of UNAIDS, we have somebody from UNAIDS here. I would like to introduce Clayton Zibio de Lima. I'm so sorry. Clayton is the Senior Advisor for Community and Key Populations at UNAIDS headquarters in Geneva. As part of the Community and Youth Engagement Team, he leads UNAIDS global efforts to support the engagement and leadership of organizations led by gay men and trans people in the HIV response. Clayton has over 15 years of experience with the UN, having previously worked with UNFPA, UNODC, and UN Women. So Clayton, can you please tell us a little bit about the work that you've done with Y Plus Global on this guidance? What is the role of UNAIDS in seeing that young people in the global HIV response?
Thank you. Thank you very much. Hope you can hear me. Normally I speak very soft, but I think here I need to speak a bit louder. So thank you. Thank you so much for inviting me to be here, for inviting UNAIDS. I'm very happy to represent UNAIDS in this panel. I would like to start also saying all the appreciations and thank you for all the young activists, all the organizations and partners engaged in developing this guidance. And if you allow me, a special appreciation for my UNAIDS colleagues, Garrett, that is here, and Alicia, that I think is online. I know that this today is a culmination of more than 2 or 3 years of work that started in 2021 with the definition of youth-led responses. And now it's amazing that we have this concrete guidance that can support us to effectively support youth-led responses. Of course, this will help us in our work in accelerating for the achievement of the targets of the 2021 political declaration. But we also think that this is a very good moment because very soon, we will be embarking in a process of discussing the next global AIDS strategy. So we hope that this guidance will also be an important tool and resource in this process. I've been here really very impressed with all the energy and with the passion of everyone talking about the guidance today. And I can tell that for us at UNAIDS, you can have our commitment that this is just the start, and we hope that we can also continue supporting now in the promotion and mobilization related to the guidance. And we hope that this promotion will help us mobilizing additional efforts to accelerate the implementation at country level, because I think the guidance is important for all levels, but we know that we need also to make it reach at country level. So count on UNAIDS on that effort. I would like also to say that internally, UNAIDS and our co-sponsors, because we are a joint program of the UN, we are already looking internally how the guidance can also improve our work and support our work. And we want to leverage our UN position at global, regional, and country level to support the access of young people to spaces that will, at the end, be meaningful for the engagement and be able to reach the change that you want to reach. We had earlier today our UNAIDS report, like 2 hours ago. We just launched our new UNAIDS report. The title is The Urgency of Now, AIDS at Crossroads. And unfortunately, the report will say that for the most of the world, we are off track the 2025 and 2030 targets. Each day last year, we had 3,600 people acquire HIV every day. And of those, 960 were young people aged 15 to 24. We know that in particular, adolescent girls and young women continue to face the brunt of the new infections, although we see some decrease. And we also know that key populations are making now up a greater proportion of new infections. And we know that we still have a lack of data about adolescents and young people from key populations. So to reverse these numbers and to overcome these challenges, it will be vital to support young people living with HIV, young women, young people from key populations, to design, promote, and implement their own solutions and initiatives. Organize, mobilize, advocate, manage resources. In summary, it will require us shifting support, shifting resources, and shifting power to youth-led organizations. And we hope that the guidance will be helpful for all stakeholders to do that. We also see this as a key opportunity for influencing the sustainability agenda. That's a very important agenda we are having the next years, because we know that scaling up youth-led responses is vital, not only to achieve the end of AIDS, but also to secure the well-being of young people living with HIV and affected by HIV after 2030. I would like to just to finish saying that normally we have all this talk about young people being the future of the HIV response, and we need to acknowledge also that although there are some very successful initiatives that are included in the guidance, that is not yet the norm, because there are so many barriers, and we need to make youth-led responses the norm, and you can continue count on UNAIDS, on our collaboration to make that happen. Thank you.
Thank you, Clayton, and also for highlighting the fact that UNAIDS also plans to use the guidance internally to help strengthen the programs and engagement that you have with young people. Thank you so much. Now we're going to go back to the Mentimeter and look at some of the responses and open up the floor if anybody would like to contribute to the discussion. Oh. Okay. Does anybody would like to talk about some of the keywords that you see here, or would like to share some examples of your organization's work and how you're also supporting youth-led responses? Come on, I know there's so many of you here with good examples. Please don't make me pick random people out. Yes?
Thank you, Ari. So it means of scale up of a youth engagement. It means of providing not just the opportunity for them to be part of the interventions, but in terms of leading them and providing them with all the resources that they need in order for them to implement. Because right now, the problem is we keep on saying that young people is on the forefront. However, it's just a couple of months, and then right after is, where are they, the young people, in terms of the HIV interventions in their respective communities? Because there's a lot of issues and concerns when it comes to accessing of the resources in terms of funding, because some of the countries need to be legalized in terms of having a own bank account, having registrations in their country to access this funding. And it should be all the capacity building, all the intervention is a whole package and not a one-size-fits-all, because we have different countries, we have different young people doing different initiatives. And we need to change the narratives when it comes of the HIV interventions. We have right now the SBCC, we have innovative way of leading the HIV response in our own community, in our own country. Specifically, let us not forget those young people in those geographically isolated and most disadvantaged areas, those hard to reach adolescent and young key populations that need to access this intervention, not only on testing, but includes the treatment, care, and support, and in all the stages, in all the levels and processes, young people should be there. Thank you.
Thank you so much. Does anybody else have anything they would like to comment? I think I would love to hear from an NGO, other organizations that are supporting youth-led responses. Do we have anybody in the audience? Do I see Frontline AIDS anywhere? Or GMP Plus? Would you like to share something about how your organization is supporting youth-led responses and the work that you're doing with youth? Oh. To me? Sorry.
Thank you, Eddie. Thank you to the panel. It was really great listening to your inputs. How are we doing this work? I want to start by first saying we haven't gotten it right. We're getting there. And for us, the whole thing around youth-led responses is really around centering young people, working alongside Y Plus and many other organizations. The biggest thing for me has been around accountability. The ability for young people and youth organizations to hold funders and program partners accountable to the needs of young people in ways that speak to young people. Secondly, it's around funding. And through the work we do with Ready is constantly looking at ways to support funding that makes sense for young people. And this comes through ensuring that programs that young people center are funded as young people desire for them to be funded, not as how we think they should be funded. And I talk about funding because one of the critical things for youth-led movements is the ability to incubate and really hold youth structures until they can become fully fledged organizations, and to follow through with funding. I think often what happens is we hear how people say we want to support young people, but when it comes to funding and putting money on the table, often that is not happening. And those are some of the 3 things we've done. But like I said, we're nowhere near achieving everything, but we will hold ourselves accountable to ensuring that we provide more meaningful support, more visible, there's a new word that I keep learning, visibilization of young people in all the important structures, and most importantly, centering young people in all strategic and decision-making moments.
Thank you, Chumi. I know you put you on the spot, but you answered that beautifully. Yes? Betty?
Thank you. My name is Betty Sharon from Kenya. I liked the word diversity. And when we support diverse youths, including youths with disability and youths from grassroots, I would like to hear what the donors are saying, especially the UNAID, what they can say about the youth organizations, especially the grassroots youth organizations. Most donors, when it comes to funding, there are those stumbling blocks. We want to see your edited account. We want to see the capacity. We want to see your experience. Now these youths are just starting their organizations. How can we build their capacity? How can we support them? In most cases, you find that donors, they would like to support those big organizations. Then the big organizations sub-grant to the youths. The amount that they are sub-granting cannot even sustain their own salary. How are the donors supporting youth to get to the next level? Thank you.
Thank you so much. You have, no? Okay. I was just wondering if anybody, okay.
So, hi everyone, I go by names of Nana Miraz and I'm from Uganda. I lead an organization called Trans Youth Initiative Uganda. I also want to add on diversity. It stood out for me because we don't live single life issues and we don't live one life issues. I'm a trans woman, but then at the same time I'm a young person. So you see how we live multiple intersecting identities. Like I don't only have one hat, I have many hats. So when we look at diversity, most times we should learn to be intersectional in our programming. Like don't think that one size fit all approach will work, like one shoe will work for everyone. It won't, because as a trans youth, my needs might be a little bit more unique compared to maybe another set of a young person. So maybe having an intersectional lens when it comes to responses, like having diverse way of programming, not just saying that because we are thinking at this, it worked for organization A and B, it will work for your organization, won't be the way we are living. So to me, it's just saying let's embrace diversity, understand that we come from different backgrounds, we come from different multiple historical, experiences that are unique in a way. They are not the same, but somehow unique. So we just have to be intersectional when we are programming and have youth-led approaches that are more intersectional. Thank you.
Thank you so much. I love the conversation about intersectionality.
Thank you. I'm Maxwell from Zimbabwe. Thank you so much for the speakers, and I'm really looking forward to the Youth Next Level. But I'm supporting the previous speaker on the issues that they've talked with regards to funding to youth-led grassroots organizations. You'll find out most of these organizations, they are scrambling for bigger grants that are only eligible for these big funded organizations. There are so many restrictions for youth-led organizations to access funding. You want audited accounts, registrations, a whole lot of stuff that are needed. But I appeal to all our donors to make sure that we also support some informally registered organizations. They are the ones who are directly implementing the work at the ground. Why can't we go straight to them and work with them, build their capacity to also, go to the next level? And the other thing is, I would like to see the abridged version of this Youth Next Level booklet. In abridged version, let's have this toolkit in the pocket, Youth Next Level in the pocket, where young people who have it in their pocket hold the organizations to account to the needs of young people, hold the governments to account to the needs of young people. And for that to happen, we need to have the abridged versions, remove all the big words, have something simple that young people can actually articulate. You know, for us young people, it's very difficult, you know, to go through the whole booklet, read the jargons and other text. Just put it simple. Even in animation, it will work out very well with young people. So that's my, my contribution. Thank you.
Thank you, Maxwell, for sharing your reflections. Did you hear that, Gareth? They want a pocketbook, a simplified version. Now, I'm very conscious of time, and we have to wrap up, but I would like to thank everybody for being here. Please download the resource. The QR code is on the screen somewhere. And also, please make sure you fill out the survey. Another question? Oh, yeah, I was going to actually suggest that they can go speak to them straight after. But if you have specific questions for our panelists, please come join them afterwards and talk to them privately. But yes, you can download the resource by following the QR code. Thank you so much, everybody, for joining. Thank you to the panelists for joining. Yes, thank you. This is a pen as a token of our appreciation.
Hello. Hi. Hi. Hello.
Hello? So sorry, folks, we're running a little bit behind on the next session, but we're working on the tech difficulties and be about 2 minutes before we get started. Thanks for your patience.
Hi, everyone. Hi, everyone. Can I have your attention? Okay. Hi, everyone. Hello. Hi, everyone. Okay, good. All right, slide. So, my name is Isaac Olushola Ogunkola, and I'm representing Youth Rise as the Global Fund Project Manager. And then I'm going to tell us a story. Okay. Yeah. And then I'm here to just share a story with us on who killed Danjuma. It's a story just to highlight the current drug policy we have in our countries, across the globe, in different countries, and in different contexts. And so we'll look at the critical analysis of our current drug policy, as well as shifting the paradigm, and then we conclude there. Next slide. Next. Okay. All right, so the life and death of Danjuma. A couple of decades ago, a young couple came together to live as family, and over time, the woman got pregnant, and then at the point of delivery, in far north Nigeria, they couldn't access health care. The family couldn't access health care. There is no traditional birth attendant in the society. And so the delivery of the child took place in their home. Unfortunately, immediately she gave birth to the baby boy, a bouncing baby boy. The woman died. And I think it is important to know that every 2 minutes in Nigeria, every 2 minutes, a woman died of maternal mortality. Every 2 minutes. That is the highest in Africa. And so, back to the story, due to some myth and myth of witchcraft and wrong assumptions in the society, it is believed that a child in this situation brings bad luck to the family. And that influenced how the father trained Danjuma. At every slight mistake, every slight error, Danjuma is being punished by the father. And this happened on and on and on for a very long time. Over time, Danjuma's father got married to another lady, and the stepmom is not helping matters. At every slight provocation, Danjuma is being punished. And at the age of 12, Danjuma decided that enough is enough. He ran away from far north Nigeria to the southwestern part of Nigeria, in Lagos. And on getting to Lagos, there are no families, no friends to talk to, no relative in Lagos, and so he ended up living under the bridge. Under the bridge, he met a new set of people who introduced him to manual labors. In order to fend and cater for himself, he goes to a popular market in Lagos, carrying load from one end of the market to another end. And after about a couple of weeks, he noticed that he couldn't carry loads any longer. His strength couldn't help him. And so his newfound family under the bridge, who are aware of what he's passing through, they have more experience on what he's going through, and they know what it takes to do a manual labor. And so they introduce him to diverse drugs, like tramadol, like heroin, like Thailand, and the likes. Yeah, Thailand is the street name for heroin in Nigeria. And so over time, he started using this drug. He gets energized to do his daily activities. He was able to work more, get more money, buy food, get some clothing, and also pay for his rent under the bridge, because you have to pay that. And on a fateful day, the National Drug Law Enforcement Agency raided the bridge, and the whole place busted into a pandemonium. People running helter-skelter to save their lives because they don't want to be arrested and incarcerated by the law enforcement agency. And in an attempt for Danjuma to escape this, he also jumped into the crowd and he ran across a highway. Unfortunately for him, Danjuma got knocked down by a moving vehicle. He got knocked down by a moving vehicle, and sadly, he died. And my question to the audience is, who killed Danjuma? Is it the drugs or the war on drugs? Who killed Danjuma? Next slide, please. And this will make us have an informed discussion around the current drug policy we have. You know, the policy we have are not helping matters. The drug policy in our countries have been able to create more harm than good. And the assumptions of this drug policy, the world drug policy, is based on 4 things. Firstly, is the assumption, the wrong assumption about addiction. The second thing is harm maximization. They have been doing more harm than good. The second thing about our drug policy in the world is the issue of corruption. And lastly, the erosion of human rights and civil rights. Next slide, please. Next. Next. All right, so I'll be focusing on each of these assumptions and dive more into it. The slippery notion of addiction. The first definition of addiction was given in the 1961 Single Convention of Narcotic Drugs. And it was described, addiction was described as evil, with no clear definition and context. But before then, it was believed that addiction is influenced by spirits. If you are addicted to anything, it was assumed that you are being controlled by an evil spirit. But over the years of doing research around problematic drug use, around drug policy, there are 3 things we've been able to realize. Many people who are addicted to drugs have some comorbidities like mental health issues. That is one. The second thing is that some of them have some social problem like poverty, housing, loss of employment. And thirdly, the so-called addiction is contestable because we are all, or some of us are addicted to various things. A lot of people are addicted to other consumables like coffee, like sugar, like fries. If you drank coffee yesterday, can you wave your hand? You drank coffee, okay. If you drank coffee today, can you wave your hand? If you drink tomorrow, can you also wave your hand? Do you have law enforcement agency here? You should be arrested, right? And also to some other behaviors like internet gambling, being on social media, people are addicted to various things. And so the definition of addiction in terms of drug use is contestable. Next slide, please. All right, and then we have the issue of harm maximization. The first iron rule of prohibition states that low-intensity drugs will be driven out by the high-intensity drugs. And with the harm maximization, we could see that there is a lack of control on the quality and purity of the substances we have in the market. The reason being that it is driven by illegal markets, and the illegal markets have no control. People can come in with various substances mixed together and sell it to the market. And also for the fact that it makes the buyer and the seller come in contact with criminals. It is being prohibited, so it facilitates a connection between the buyers and the sellers, who, in quote, may be innocent people. Next slide. Also, we have the erosion of human rights. We can see at airports today, people are being searched, people are being taken from their workplace, from their schools, and urine test is being conducted on them. This is violating human rights. We see houses being raided, the enforcement agency busting into houses, destroying people's property in an attempt to arrest, in quotes, criminals. Also, we have environmental degradation, where enforcement agencies go to people's farm and burn them because they are farming cannabis. All of these have negative impact in the society, and it is eroding the rights of humans. Next slide, please. And lastly, corruption. The law enforcement agencies are corrupt. Politicians are also into illegal drug trade. They are facilitating the movement of drug from one point of the city to another. Politicians are getting kickbacks to keep making most of this drug illegal in order to line And then shifting the paradigm around drug policy. Do you know that over $100 billion is being spent on drug law enforcement every year? Every year, over $100 billion is spent on drug law enforcement. And in case you don't know what $100 billion could be, let me explain better. 1 million seconds, you can count 1 million seconds within 11 days. If we are to start counting 1 million seconds, 1, 2, 3, it will take us 11 days. To count 1 billion seconds, it will take us over 32 years to count 1 billion seconds. And now imagine $100 billion spent on law enforcement every single year. Imagine if a percentage of this $100 billion is invested in harm reduction and healthcare. Imagine a percentage of this $100 billion is being invested in creating job opportunities and employment for young people. Imagine a percentage of this $100 billion is being spent on schools and education. We'll be having lesser problem in our society. And so at Youth Rise, we are a new generation of young activists that are fighting towards bringing justice to people, promoting harm reduction, especially for young people. Next slide, please. And also, it is important to also state that we've been doing this for over 18 years, and we are calling on everyone here to let us come together to create opportunities for young people who use drugs, also providing them with the support, education, and economic opportunity that they need. And so, I would like you all to join me in this advocacy. And I would like to end with this. When I shout support, I want you to say, don't punish. Support. Support. Thank you.
roaming mic.
Hello.
Oh yeah, Maxwell. How are we gonna join you in? Can you shuffle around like? Yeah. It's these. Let me. So I'll just ask you those three.
Okay.
To all of you. Oh, sorry. Okay. Yes, we'll just leave. They'll just speak there. They'll just stay there. Sorry? Yes, I'm just going to stand here and then just stay. I don't feel like sitting there. Thank you. All good? Okay. Hello, everyone. We are about to begin a session on digital health, tech, human rights, and youth participation. So take a seat, grab whatever drinks are left, get comfortable. We've got some amazing speakers. I'll give you 2 minutes to draw in. Okay, we'll get going. So, hey, my name is Molly. I'm advocacy manager at an organization called Stop AIDS, and we work with a project named the Digital Health and Rights Project, working in the UK, Ghana, Kenya, Colombia, and Vietnam to conduct participatory action research on digital health and rights. It's something we're really passionate about, and we're really not seeing much of in discussions at the AIDS conference so far. So our research has demonstrated that health is a critical sector impacted by, and that will be continually transformed by permanence of health because of their profound impact. So it's something that is rapidly changing, and we really think there should be a conversation about it. So in this session, we're going to hear from a range of speakers who are working in the digital technology space in different interventions around the world. And we also want to understand a little bit about what you understand digital technologies to be. So to start with, hopefully we can get the slides up. We've got a Mentimeter for you. Just transition to the slide. So the question that you'll be answering in a moment is, what do you think of when you hear the phrase digital health? So have a think already. For some of us, that might be technologies we already engage with. I don't know if anyone's wearing a smartwatch or has an app on the phone to access their healthcare. It can also mean things like WhatsApp channels that you use to share information with your friends, or crazy things like artificial intelligence that can manipulate data and figure things out. It's not working? Okay. Anybody want to shout something to the stage about what you think digital health is? Someone feel confident? Screen time. What do you mean by this?
I personally feel my least healthy when my screen time is above like 10 hours,
Yes.
which is a lot. So, but
Great. I think, yeah, definitely. So we see, tech can help us to be more healthy, but it can also impact our health, especially maybe our mental health. And we have to be thinking about that when we plan interventions. I feel like with young people, there's a big push to do digital interventions because digital people love their phones, but it's not always great. So yeah, thank you for raising. Anyone else have anything else? Other technologies? Anything you're worried about? Yeah, over here at the back. There's a microphone just coming.
Okay, I've noted that in digital health, you can use anything in relation to technology.
Yes.
Our young people nowadays, they are always on the phone, especially using WhatsApp platform. At times they use text messages, even calling using the phone is part of digital health and is something which is like modern
Yes.
and new, especially for the young people. They are really interested in that.
Yes, I agree. And I think it's really important that we talk about involving young people in digital health technologies. We have our QR code, but it's okay. We've had our discussion and we have some amazing speakers. If you want to contribute, just so that we know how you feel, then you're very welcome to. And we can discuss afterwards as well. But I think we have limited time, so I'm going to move to our speakers and they'll discuss some of these issues. So mental health and the use of WhatsApp and apps and AI and other digital tools, the way that we can engage young people and also the skills that young people need to be able to engage with these tools safely. So our panel is 4 persons who are doing amazing work in this space. And I'm going to let them introduce themselves and the work that they're doing. And then we're going to ask 3 questions. And throughout this session, I would love if you could think of a question to ask our panelists to make the most of their brains and resources. So afterwards, we will have a question and answer session where you can pose your own questions as well. So I'm going to hand over to my panelists to give an introduction to themselves and also to tell us a bit about the work that you're doing, what inspired your project, and why you think it's important to be doing this work. So do you want to start off? Yeah? Okay, amazing. A round of applause for our panelists.
Hi, everyone. Nice to meet you and nice to see so cool young people here and so many of you. My name is Evgenia. I'm a deputy director in the Ukrainian charitable organization Teenergizer. Maybe you heard about it. Somewhere there is a stand, there's some more information about us. So my organization is working across Eastern Europe and Central Asia region to provide psychosocial and psychological help to adolescents and young people, and we do everything of this in digital. Our project was inspired by the fact that in our region, unfortunately, the rights of young people are not really taken into account. Like we have a lot of old men, old women that are in the power, and that they do not think about our next generation, they think about their own self. And in Teenergizer, we wanted to create a big community and grow up our own young leaders who will be then advocating the rights of young people and who will be also helping to young people. And what was the third question?
Why do you think it's important to have that kind of intervention in this space? Or why would you be using digital technologies especially for that?
Yeah, so digital technologies are actually the key instrument for my organization to reach to the young people, because all our youth is staying online, and we provide our service confidential, free of charge, anonymous, also online, and we provide our service. Why we are unique? We provide our service by people, so we have online bot, but in this there's real people that like peer counselors who can counsel adolescent and young people from our region. Oh, I'm a little bit nervous, sorry. And I can say, like, for me, it's a little bit weird to speak about digital in Ukraine, because at this moment we have shortages of electricity, like from 4 to 24 hours per day. My competitors are very flexible. When you come to Kiev, you hear the sound of generators everywhere, so like saying online, but at the same time, you're really lucky to have electricity here, believe me. So I'm transferring my word to my colleagues.
Yeah, okay, thank you for that. So my name is Timothy Wafula. I work for an organization called KELIN, which is the Kenya Legal and Ethical Issues Network on HIV and AIDS. KELIN is part of the consortium that Molly mentioned, which is the Digital Health and Rights Consortium that is working to advocate for rights-based digital governance in health. So maybe just to mention why the work on digital health and rights is important for my context, or why KELIN works on this area, is that over time you will know that the right to privacy for people living with HIV is very important. So over time, you know that breach of the right to privacy can really lead to serious other harms that can happen. So when the right to privacy is violated, that is whereby somebody can be exposed to stigma, discrimination, violence, and so many other harms that happen. So over time, I think KELIN has been working to ensure that we are having strong laws, strong policies to ensure that the right to privacy is protected. So maybe previously, the threats to the right to privacy will take place maybe at health facility level, whereby maybe somebody goes to seek services, then they get, maybe their right to privacy is exposed by the healthcare worker, or also maybe in other areas in the community and so on. But currently now we have a new space, which is the digital space. And now we are having services, access to health services through digital platforms. Then the question becomes, how is the right to privacy protected within these digital platforms? Is the same right that is extended offline also being protected online in the digital platforms and so on? So that is why I will say, to a big extent, KELIN works in this space. And in this particular project, we are working to ensure that we are able to define what this future of human rights in the digital age looks like. And happy to have this conversation with all of you today.
Hi, everyone. My name is Maxwell. I'm from Zimbabwe. I'm with Restless Development, and I'm the programs coordinator. So with Restless Development, everything that we do, and we do it for young people. So our heart, young people are at the center of everything that we do. So with digital health, we realized so many young people these days are online. It is a digital generation. So we find out that this is the space that we can utilize to educate, raise awareness, give out information, enhance the uptake of HR services for young people. So I work in African context, and these days so many young people are online. So what we are doing is we are working with young people across the African context, building the next generation of activists online using digital. So what we do, these young people, they conduct sessions with young people, raising awareness on different issues. But the main goal is to end AIDS by 2030 as a global pandemic. So we are using young people in different spaces. We have young people who are into arts. We have young people who are doing different kinds of things using different social media platforms like TikTok, WhatsApp. With African context, it's not so many young people who can afford, data bundles. They are quite expensive. So you find out most of the times these young people, they are not online. So we don't also leave them out. So we use some offline platform applications with the young people. For example, managing their periods. We need to have those kind of applications for them as well, so that they'll be prepared for what's coming especially for young girls who are in school. So those are some of the work that you are doing with young people online in terms of digital. And also, there are so many issues that are happening looking back what the pandemic have brought, the shadow pandemic of the GBV. So many young people have been depending with getting information online. So we have capitalized on that to make sure that young people continue to use the information online. They now don't have to travel long distances just to seek information. They can get it, on their fingertips. But now, if they need it, if they need more examination and so forth, that's when they can go to health facilities. So we are now, talking about some of the things that we're not normalizing, like talking about issues to do with self-care, mental health. We are now also talking about that online as well with young people, so that it's becoming a norm, for young people due to the digital generation, to the digital technologies that we have right now. Online. So for us, we are trying to empower the young people, amplify their voices using online spaces that they can, use, whether they are using art, they are using music, they are using skits, they are using all sorts of things, poetry, whatever they can find just to raise awareness on different issues that are affecting young people across the region. And the one last thing that we're also doing is there are issues to do with policies, young people raising awareness, holding decision makers to account on some of the commitments that they've made. In Africa, there are so many good policies that have been put in place, but there is no accountability on those issues. Duty bearers, they are not adhering what they have committed to do. So what we are doing is we are using the digital platforms to raise awareness on what the policy makers, especially the governments, have committed to do, so that these young people can hold them to account, monitor the progress that they've done, even budget tracking on what the governments have committed. We are also using the digital spaces to do that as well. So you find out there are a range of activities that our young people are doing using the digital spaces. However, there are so many young people who can't afford to go online. I think that's another discussion that we need to have. What are we going to do with those young people who are in hard-to-reach areas where there is no network coverage, but they also need to be reached out? So I think those are some of the activities that we are doing in Africa. Thank you.
I have my presentation on.
Yes. Can we have Tung's presentation, please?
Hi everyone, my name is Tung, working for Y Plus Global, but I also support an organization in Vietnam called Lighthouse. So unfortunately that they are not able to be here today, so I will try to share with you some of the work from Lighthouse in Vietnam. I totally agree with all of speakers about how important it is of using digital to delivering messages, also bridging the gaps in terms of the information for young people, and also promoting for services and make sure that young people can access to the services that they need. So this is one of example of how young people in Vietnam, they use the digital to promote for the information and also services to young people themselves. It's called Rainbow Health Station, and it's focused on sound health, sharing experience of young people together, play fun. So it's not just only about HIV and AIDS or the information about the health, but how they can get the pleasure while having sex, how they do cam sex in the safe way, live and love. They also can share some the love stories with each other, and then we also promote for wellness. Next slide, please. Yes, so this is the first page of the website. As you can see, it's promote not just only the HIV and AIDS, but also the other function that community can using. Next, please. Great. So the first function that I want to emphasize is to promote for the trusted information for young people. So we're just trying to make sure that the languages we use is really friendly and easy to understand for young people, and make sure that they can access to not just only HIV, but also how to do self-care, promote for mental health, harm reduction, and also gender-based violence as well. And next slide, please. This is another function that I think is really cool, that people can go online and do self-assessment. So we offer them with different kind of self-assessment so they can, because sometimes they feel fear of stigma and fear of disclosure about their own issues and their own concern. So self-assessment can help them to really monitor their health. So we have the substance abuse screening, we have the mental health screening, we have the HIV risk screening, and also the PrEP screening as well. Next, please. This is the Rainbow Doctor. So after they do the self-assessment and they know what is the problem is, like what is their health status is, so they can be connected to the doctor, Rainbow Doctor. So we have the hotline and helpline, so they can easily to call. And then we have 3 different lines, one focus on HIV counseling, one focus on mental health and support, and one another on harm reduction and chemsex. Next, please. This is the service map. So we collect the information of more than 200 health facilities in Vietnam and put it in the map. So it is a live map so people can easily to find the services near them. For example, like I travel to the north of Vietnam, so it's easily for me to find like where I can get ARV, where I can get the free condom and lubricants. And after using the services, people also can rate the quality of the services, so to make the other know like, oh, is it good quality, so I should go to this clinic or not. And next slide, please. This one is the pre-ordering, so people can order the free HIV self-testing kit and also condom and lubricants, and we can mail that to their home. And it's very easy for them to really access to the commodity of HIV testing and also HIV prevention commodities. Next slide, please. This is our online on TikTok. So we create a lot of videos because we have the confession function. So people can send the letter, they can send the confession. So like what they think about, what is their problem. So we're trying to have some video to really address their letters and what is their concern. And we reach about like 1 million views on the TikTok right now. So I think it's really cool to really reach the number of people on TikTok at the moment. And next slide. This is another, so we play and fun not just only the services and information, but we also have some games for them to get some gift from our website. So they can play, this is a lucky wheel, so they have to register as a member, and then they have to complete a risk assessment, and afterwards they can sprint the wheel to have a gift from our website. And you can see the gifts can tote bag, also the raincoat, and also the bracelet. And a sticker of the LGBTIQ community. And next slide, please. I think this is the last slide. So this is initial result from our website. It just launched last month. So in total, we have 6,000 website visits. We have more than 12,000 Facebook follows, and also nearly 800,000 TikTok views for the videos. So I think it's still like, going on, and we hope to reach more people, especially young people who are not, feel comfortable to go to the physical health facility, so they at least can access something on our website. So yeah, I think that is the way we are doing and using digital for young people.
Thank you so much to our speakers. I'm sure you agree that's amazing work, very diverse work as well. Some advocacy, some movement building, and some direct interventions. And I think the range of speakers demonstrates that digital tech can be both a good thing for health and potentially a risk to health as well. So we heard about the potential creativity and amazing accessibility for young people of these programs, but also a couple of issues raised around access to data, access to information and the correct quality information, and concerns around kind of data privacy and anonymity. So we have a couple more questions for our speakers, but again, do keep in mind if you have any specific questions about the programs or advocacy that they're doing. The next question I'd like to ask, and we may need to keep it brief, I'm sorry, is, what do you think the key benefits and risks are in tech for health for young people? And maybe you want to raise a couple of each in your work specifically, and what really stands out as the key issues that we need to be tackling today. Maybe we can go Timothy, Maxwell, Ivenia, Tung?
Okay. Yeah, thank you. And thanks for the question. So I think in terms of just starting with the key benefits. So this is now, I'm drawing this from the study that we undertook with the partners in the Digital Health and Rights project. So one of the key issues that kept on coming up was that the young people felt that in online spaces, they can access services in a less stigmatizing manner, yeah? Like they'll feel like if I go to a health facility, I'm likely to face discrimination, stigma, but now through online space, I can seek services, seek information, health information, in a manner that, because it's online now, that I'm less likely to face the kind of stigma and the discrimination that I will face in physical space. So that becomes a key benefit now, just that access to information. And I think just the way you've shared, also some of these platforms really provide a good avenue for peer information, yeah? Where peers can be able to connect, you can be able to get information from each other, to be able to get experiences, learn from each other, just have a networking aspect to be able to easily access such kind of information. So that becomes important, and I think, just to note that digital platforms, digital technologies, AI does come with its own benefits, of course, even sometimes even bridging the barrier to access to health services, health information, maybe through telemedicine and such platforms and all these. And of course, even accessing information that you will not otherwise have accessed now through either the platforms, maybe through just Googling it, going to social media sites, and so on and so on. But the risks also are there, and it's important that in this conversation whereby now we are increasingly encouraging or using digital technologies and AI in healthcare, that there's that importance to be able to ensure that the risks that also come with the use are addressed. So for instance, what could be some of the risks? And I'm sure this one you could bear witness. You know that maybe in online spaces, there is a lot of maybe sometimes online harm and risks. So for instance, cyberbullying, harassment. So especially if somebody is able to know maybe person's HIV status, health status, or any other status. Maybe you're a member of the key population. So all these becomes avenues for cyberbullying, cyber harassment, and so on. So that becomes a risk. So then the question becomes, in the online space, if somebody experiences these harms, whether it's harassment and all this, do they have recourse to legal redress, for instance? So does somebody know if I'm bullied online, this is what I can do to access justice? So maybe if it's online, that I can go to our police station, I can report, but online, on Facebook, Twitter, TikTok, what do you do in that instance? And I think that information becomes important. And I think importantly is always the risk of ensuring that the right to privacy, confidentiality is actually protected in online spaces. So speaking now about maybe HIV status, health status in online spaces. Health status is such kind of, I'll say, sensitive personal information in online spaces. So at the platforms where we are sharing this information, where these health services are being offered, are they in such a way that this right is actually being protected, being secured, that your confidentiality in sharing this information is also protected? And also, I think maybe lastly, I can just mention a last one and allow my colleagues to contribute to the conversation, is also in online spaces, the risk of misinformation, yeah? You can go on Facebook, people will share maybe all manner of information, some of which are not true. And so how do you safeguard in knowing which information is correct, which information is wrong, who is sharing the misinformation, who is sharing disinformation, and so on. And I think lastly in the context of HIV, key population, sex workers, men who have sex with men, trans people, and other key populations, there is always this risk around if I'm accessing health services in online spaces, I'm giving willingly my health data, but I'm still a criminalized population in some country. Will the government be able to get access to data about me and me being criminalized? Will that also expose me to the harm that, or will the government use that information maybe to prosecute you, knowing that you are criminalized in such a population? So these risks, these harms really need to be balanced in terms of, in moving forward, how do you ensure that in using digital health technologies, AI, the benefits are in such a way that they outweigh the harms, but also the harms are addressed actively in that space. So thank you. I'll stop at there and maybe provide my colleague Maxwell. Yeah.
All right, thank you. I think there are so many benefits to digital health tech. The first one, or the obviously one, is the reach. We'll be able to reach so many young people with information that you want, as compared to face-to-face. You know, so many programs, activities are being implemented face-to-face, but with digital tech, we can reach so many young people, whether it's on Facebook, whether it's on TikTok Live, so many ways that you can reach young people as well. You know, the other benefits is young people can get, up-to-date and relevant information on time as they need it. You know, young people, they engage in so many risky behaviors, and so many of them, they don't talk about it. They are shy to open up to someone. You see, I've been having a conversation with young people, they will tell you, you know what, I've been Googling symptoms of gonorrhea or chancroid because they had an unprotected sex. So with digital tech, they can actually, get all that information on time, and it can also help them, to see if they really need medical attention there and there. Digital tech as well can help, bring about so many issues that young people are facing, and they are not being able to talk about it directly. I think that's the greatest benefit, so that young people, they remain anonymous, but they can also tell us the issues that they are really facing, and the issues that they feel like they need to be prioritized. I think my colleagues talked about the peer-to-peer. I think that's the most important part. Young people themselves are re-educating each other through digital tech. The Gen Zs, motivating each other. Let's do this. How can we move forward? If one young person starts a movement here, it can go viral because it has been started by their colleague, and they can relate to the issues that they are facing. It's peer-to-peer. So I think those are some of the benefits of digital tech. In hard-to-reach areas, digital technologies can be used to deliver even life-saving medications to young people. In most of the parts of Africa, they are now using even drones, to send medication, ARVs for young people in time, whatever they need. I think that's really commendable and it's needed. However, it has got its own risks. Taking into account issues of misinformation that they've mentioned, I think that's one major risk that young people are facing. Anyone can upload anything online and young people can access it. It may not be true and brings more harm than good to the young people. I think that's the major risk that young people are facing. Cyberbullying as well. So many key populations, they are not able to express themselves, their views, just because they fear of harassment online. If you look at, I know there are Twitter wars that happens, especially in Africa. Yeah, it's one of the major reasons why some of the young people, they get, harassed or bullied online. So I think there's really need to ensure that young people are educated on how to use those, and also to encourage our African governments, to strengthen some cyberbullying acts. There are so many policies that are there, but they are kind of silent in some of these things. So we really need to raise awareness of them so that young people can be safe online, because you realize a 6-year-old will be online, what kind of information are they accessing? Are they safe? What are they watching? Who's uploading that kind of content? So it's very important to ensure that there are so many acts and policies that are protecting young people online. Yeah, thank you.
Thank you, Timothy, and thank you, Maxwell. I fully agree with you. And actually, yeah, the key benefit when we're speaking about digital and providing the health in digital, especially mental health, is the access. But it's also uniting our teenagers and adolescents and youth because, for example, in Ukraine, Kazakhstan, Kyrgyzstan, or Tajikistan, where Teenergizer works, we can have teenager in a small village, teenager who is living with HIV and who can be facing bullying in the school and who think that he's or she or they are the only one and like alone. And then this teenager goes to our social media, our website, our articles, or our chat with peer counselors, or our training. So like we provide different activities to participate and participate fully online. And that teenager, they see the people also living with HIV, people who become a leader in participating in the big conferences or doing a lot of work in their own school. And it helps to recover, to find the strengths, and also to advocate the problem within own society, within own small village, and to change this world. And also I think the benefit is in managing a large numbers of different beneficiaries, because in Teenergizer we have around 9,000 requests per month for peer counseling. And it helps us to provide the service to a lot of people from, as I said, from very different places, and we don't need to have a counselor in every city. They can access it only online. But if to speak about these benefits, I think there's also risks, the risk of safety. A lot of us face this breakdown of Microsoft coming here, and of course the data leakage also can be possible. And that's in what Teenergizer is very conscious about, and we think a lot about while providing our service, especially peer counseling. So the data from the confidential chat will not leak to any of the people who can harm that person. For example, we have also requests from the occupied territories in Ukraine, from people who are LGBTQI+, and maybe some of you know, maybe not, but in Russia, those people are extremists and they can be sent to prison or bullied, or killed also. And they can access our chat and speak while being on that territory, while not having ability to go out. And we try to help just by this digital. And also I can say that in Teenergizer, we are against using fully digital, like bots and so on, algorithm, because as a deputy director, I'm all the time checking the different bots where we refer or different organizations, and we having some applications with which you have to be very, very I forgot the word because I'm not speaking English usually. So you have to be also conscious about the data that you provide to the bot where there is no person, it's only algorithm. Because the data leakage, and the second one, I once to try it and I was like pretending that I'm the person in depressed mode. And I was like writing all my feelings to that chat, and the bot said that, oh, sorry, I don't understand you, please come again later. And I was like, if I was really in the depressed mode, what I will feel. And therefore, we are using digital, but we are doing it with people involved and with real people that can provide empathy that is very, very necessary, especially when you want to receive counseling or when you want to share your thoughts or when you want just to get information and to speak a little bit. So I'm giving my word to...
Great. Well, I think you cover all, and you speak very well about that, so I don't know what should I add. So I just summarize what people just mentioned. I think it's really important to recognize that using digital can help us to like bridge the gaps of information to make sure that community can really access the information that they need, right? And also improve the health access as well. So we have a lot of like, you know, the telemedicines and online services, so community can easily to get access to the counseling section and also like, you know, seeking help from the other peers on online. So that is brilliant that you just mentioned. And I think the only thing that I will add in terms of the benefit for the using digital is the data-driven insight. So it means that we can use the big data to really design the appropriate program to really engage the community, understand the very diverse community, what they truly need, and how we can design the program to cover their like very diverse needs in their way. So I think that is some of my art in terms of the benefit. In terms of the risk, I think you mentioned about the data privacy and also security. That is really important. You also mentioned about gender-based violence on online and cyberbullying as well. That is so true. And I think it's also really be mindful in terms of like, we have to understand that young people in different areas, they have the very different access to the you know, digital spaces. So it's mean like we can increase more choices for the community, but not like using only digital to reach the health, to reach the young people. But we also need to have like the other combination for young people who live in rural area where they cannot access to the digital spaces. So that is some of my adding point. Yeah.
Amazing. We're slightly competing with the noise, I think, which maybe signals that we should wrap up soon. I have one last question for our panelists, but I also want to give an opportunity for others to ask questions if you have any. So if you have a question for the panelists, could you raise your hand now? And we have a walking mic. So I'll raise my question, and then we'll hear from Prim and from our colleague over here. So my question is just, do you have one line on what young people can do to make sure that they benefit from technology instead of engaging with those risks? So how can you mitigate risks for young people? Prim has a question on the front row.
Yes, thank you. Thank you to all the speakers. I just wanted to understand how you're tapping into the existence of AI, actually, to promote digital health, or if not, what your perspectives of AI are. Is it enabling, you know, access to health, or it's actually inhibiting access to health?
Thank you, Prim. And we have one question in the green scarf. Do we have another question on in the floor? Yeah?
Thank you. So my question is to Maxwell. You mentioned the use of offline platforms. Hello, can you hear me? Okay, so I'm saying that you mentioned the use of offline platforms. So can I get some examples? And then you also made mention of using those offline platforms for youth who don't have access to data. But do you also target out of school youth, as in youth that are not in school? And if so, do you use these same offline platforms or other means to reach them? Yeah.
Did you catch it? You got it. Okay, we need the... Thank you. Okay, so what's your engagement with AI? What can young people do today to protect themselves when using digital tech? And a question for Maxwell on offline platforms and data access. Tung, can I go first?
So, I'm sorry, it's a little bit noisy, so it distracts me a little bit. In terms of the question about the AI, I just had a very interesting conversation in the previous section about the roles of AI in terms of like, it can help community to better access to the services and information. And I do believe that there are very huge potential for AI to play a role in terms of like increased access to the services among young people. But I think like it's always the pros and cons, right? Like we also be mindful about in terms of accuracy of the AI and information, what is provided to our community. It's not 100%, accurate information to the community, and also in terms of the how we use the AI as well. For example, like with our website, we integrate the AI into the chatbot. So if community have any a very simple question, so AI can help to respond to that. But then we also provide multiple choices for them because we do understand that community have very different needs. So perhaps they want to talk to the real person. So we will have online counselor who can talk to the community. But if someone they feel oh, I'm not ready to talk to someone, I don't want to share my own story to the real person. So maybe AI can help to address those issues. So I mean always doing it with some mindful, there are very diverse needs from the community, so we can provide them with multiple choices for that. And in terms of the question about how can we help the young people to be benefit from the digital, I think firstly, young people, they should educate themselves about digital literacy to really understand how they can use and optimize and maximize digital platforms to find information to seek the services. And I think second point is about using the trusted and also top information that is maybe from some organization like Stop AIDS UK or maybe Y Plus Global. So that could be a very good resources for them to access the information that they need. So I think I have some other point, but I will leave it to the other panelists to share their own perspectives.
Thank you, Tank. I fully agree with your thoughts on this question. And actually, when in Ukraine, AI is very popular. ChatGPT, our adolescent and young people use it all the time. I can't say that it's very beneficial sometimes, especially when you're studying, but nevertheless. Returning to the question, I think when we are speaking about AI and digital mental health, the first thought that is coming, to use AI as a psychologist for yourself. I faced not a really good example, and actually in my organization, in Teenergizer, we are really against fully including the AI in the actual service. But the good thing of AI is in promotion, because you can ask a simple question, if I'm feeling not really well, I want some information on HIV and so on, and AI will not only give you the information from the Google, but will give you some links to different organizations that are working on this topic and where the real human can help you. So you have both. And actually, yeah, this is all I wanted to say. Maybe Timothy Maxwell?
Just to interrupt, I'm really afraid we're running out of time.
Okay,
so if you can give a brief answer, and we can discuss more afterwards if anyone wants to stick around. Okay. Timothy, take it away.
Thank you. So I think in 1 minute, I can just say what young people need to do just to ensure greater engagement. So I think the one thing I'll say is young people need to continuously be engaged in the conversations and shape the conversations, because if it is something that this is the new reality we are moving towards. So in sharing the kind of experiences that will shape the laws and policies, regulations that need to be put in place, but also information to shape the kind of digital platforms that are there. So being at the center, pushing back where technologies come and there's been no meaningful engagement in that. And I think lastly, maybe just also to, on the AI issue, I think one comment I can say is just on the, one of the risks, and I think something to check on is always the issue of marginalization. So there are people who are marginalized in real life, so how do you safeguard from further marginalization happening in online spaces? Because sometimes, that risk is a big reality that can actually happen with the use of AI. So thanks.
Okay, thank you. For me, I think on the issue of AI, I really think AI can be a game changer, really, in terms of providing digital health services to young people, especially issues to do with self-care, mental health. If you really integrate AI, I think that could actually help. However, if young people need, someone, not a machine, to help them to talk, then they can get a counselor from that. But because young people have diverse needs, but AI, the only issue with AI for me is issue to do with accuracy and specific needs that the young person have, real life example, lived experiences. That's the only thing that will be lacking with AI. But I really think it will be a really good game changer in terms of providing support to young people in terms of their self-care, mental health, and other issues, if properly integrated. The other question was on offline application, especially on managing young people's periods. You find out that these help young people to really prepare to know. In the next 2 days, I'm going to gate my visitors. The periods are going to be here. So this is how I'm going to prepare. You find out so many young people, especially in hard-to-reach area, rural areas, they miss so many days of schools just because of period cramps, because they just came unexpected. No, it's not unexpected, but they were not prepared with it. But using offline applications, they can really help them track their periods and how to prepare for them. Even accessing other information, there are other booklets that you can upload, offline, that young people can easily access and educate them on different issues that they might need. For them to access data, to go online and Google something or ask AI or go on WhatsApp, they might not have the data, the funds to do so. But with offline application, they can easily help them access the data anywhere, whether without network connectivity. I think that really helps. I think my one last line is for our call upon young people to really embrace, digital tech. It really help them, improve their health, improve service uptake. I think that's another demand generation tool that we really need to use as programmers as well to ensure that young people access services. We really need to use the digital tech. Yeah, I think that's it from me.
Amazing. Thank you so much. We are completely out of time. Round of applause, please, for our amazing panel. We'll be sticking around for a couple of minutes if you have any questions. I think next we have a yoga session, so do stick around. Oh, I love the ooh. Do stick around. We've got loads of amazing activities all week. Come and visit us. Thanks again.
Test, test. So, hello everyone. I am Elle, and I'm very happy to be here today. So, whoever wants to join the little yoga session can come and have a seat. It's going to be easy. It's going to be for everyone to just relax a bit, the upper body. So, you do not need to have any skills, it's all levels. And whoever wants to join during the session is just welcome to take a seat. We're just going to wait a little moment and see if other people are going to join us. The whole session is going to be in a seated position, so super relaxed. You do not have, as I said, to have any advanced skills for that. I'm very happy to be here today and to share these moments with you. And for those who want, you can come and sit in the front. Nothing's going to happen. I'm very kind and so we'll just wait a little moment and then we'll start the session. So don't be shy and come and have a seat. Yes, come and join us. It's going to be a very smooth, relaxing session. You do not worry about any skills. Every person is welcome to join who wants to stretch their neck a little bit, who wants to relax and open up their chest and upper body. So we're going to start the session now. And whoever wants to join is welcome to join even while we're practicing, okay? You can just jump in and relax with us. Come and have a seat, everyone. Come and have a seat. It's going to be nice. Come and have a seat for some stretches. Yes, that's it. Yee, good. So, I am Elle, and I'm very happy to be here today. I've been teaching yoga since 15 years now. I'm a sound healer and energy worker. And today I'm here to practice with you some seated yoga. So yoga is the practice of different levels, but today we're going to be practicing the body, so the asana. And to start, I'm going to ask you to put both of your feet on the ground and to really feel the ground. And to close your eyes for a moment to really take a couple of minutes to reconnect to your body. So first of all, feel your feet pressing into the ground, starting to connect with the ground. Allowing to relax your lower back, allowing your sit bones to become heavy. Really feeling that support of the chair holding you right now. And then just relax your belly. And relax your shoulders. No pressure. Really feeling that space between your shoulders and your ears. Relax your jaw. And now relax all the muscles in your face. And now I'm inviting you to take a couple of deep rounds of breathing through the nose. Inhale. Feeling all that positive energy entering your body, expanding. And when you exhale through the nose or even through the mouth, release whatever needs to be released. Allowing all the tension to go away. Allowing with every exhale to connect even more to this moment. Deep inhale through the nose. Allow peace to enter your body. Exhale, let go of everything that doesn't serve you anymore. And really staying in this moment, no matter what is happening around you, connecting to your inner self. Allowing to really be in this present moment, because this is all what matters right now. You here, sitting on this chair and connecting. And starting to really acknowledge what is happening in your body while you're taking those deep rounds of breathing. How the body is feeling when it's breathing consciously. How the chest is expanding when you're inhaling. And now starting to grow your spine with your next inhale. Grow the spine, feeling the space you're creating between every vertebra. Feeling the space you're creating in the front of your body for your heart and your lungs. Inhale and exhale. Again, inhale, grow your spine. And now with your next inhale, I want you to really push the back into the back of your chair and feel that connection. Feel that support. Yes, beautiful. Feeling the presence of your body here and now. And now starting to walk vertebra by vertebra all the way up until you reach your neck. Moving all the way up the back of your head until you reach the top of your head. And then coming all the way down to your forehead and imagining how you are lightening up your forehead as if you are going to turn on a little light now. Allow the forehead to become very soft and light. And allow that golden light to expand in your head and move all the way down like a wave moving through your body, nourishing all your body. All the way down to your sit bones, all the way down into your legs, into your feet, touching the ground, connecting with Gaia, Mother Earth. And now bringing your hands in front of your heart if that feels comfortable for you. Your thumbs touching your chest. And setting an intention for today's session. Some kind words or a wish. And then repeating that intention a couple of times in silence just for yourself. I am respect, I am love, I am giving, whatever it is you want to expand and to bring more attention to. Beautiful. And then you're going to exhale and bring your hands on top of your thighs. And start to move your shoulders a couple of times. Just round a bit to the back. And then you're going to start moving your shoulders to the front. Just creating all that space in your upper body. Good. And really staying in that connection with yourself. And then you're going to bring your hands on top of your shoulders and you're going to bring that movement to the front and really open up your chest. Like, don't be shy with your body. Really connect. And don't stop breathing. And then you're going to move to the back. Really move the elbows, open up your chest. Beautiful. And if it's okay, we can put on some music now. Yes, beautiful. And then with your next inhale, you're going to push your hands up. And you're really going to open up the side of your body. And with your next exhale, you're going to just move the body slowly slowly to one side. Inhale, you're gonna again come back to the middle of the body, and then you're gonna exhale, go to the other side. Yes, and enjoy the stretch. Inhale, long back. Exhale, move to the other side. One more time. Inhale, and everyone is really welcome to join the session. Exhale, and to take a seat if you want. Inhale again. Stretch the body, and now you're gonna bring with your exhale your hands to the back of your head, and you're gonna turn the head down. Like you're really gonna bring your chin to your chest. Okay, inhale again, raise that body up, pull everything back. Exhale, you're gonna round everything. All right, one more time. Inhale. Open up the side of your body. And now with your next exhale, you're going to move the body to the other side. Inhale. Beautiful. Exhale. Good. One more time. Inhale. Exhale. Last side. Inhale. And really keep those shoulders away. Exhale. Good. We're going to push now our hands up to the ceiling. Inhale. And with your next exhale, you're going to twist to the right. So you're going to coming down, and relax your shoulders. Inhale up. Exhale, go to the other side. Keep that upper body open, your heart expanding. Inhale. Exhale to the other side. Yes, beautiful. One more time. Inhale, stretch your arms up. Exhale, release. And just give yourself a moment to connect again, to just feel what this is doing to your body. Just allowing that space to be in this present moment. Beautiful. So we're gonna move to the hips now. So if it is possible for you to cross your legs, so you're gonna stay on your chair. I'm gonna take a chair. So I'm going to show you what I'm doing. I want you to try to bring your right foot on top of your thigh. Beautiful. And then you're just going to feel into your hip. So for some of us, it's going to be a little bit maybe more challenging. So don't push. Just breathe into it. Allowing to connect to that moment. Yes. And then you're going to inhale, raise your arms up. And exhale, you're going to turn to the thigh that is lifted and open up your chest. Yes, beautiful. And it's okay if it's different sides for all of us. Connect to yourself and stay focused. It's your practice. Yes, good. Inhale, coming back to the middle. Stretch your arms up. Exhale, release. We're going to switch legs now. Bring the other side. And really trying to open up that hip. So put the foot on top of your thigh. Yes. Feeling the stretch on the outer edge of your hip. Good. We're going to go further now. Inhale. Exhale. You're going to turn to the leg that is on top. You're going to open up that chest. You're going to try to move those shoulders away from your ears. Good. One more inhale. Exhale. Now come back to the middle. Inhale. Exhale, release. Good. Again, feeling both feet in the ground. Beautiful. And now close your eyes for a moment and just start moving your hips very slowly. So no one is looking. Close your eyes and start moving from the lower back, really connecting to your hips. Beautiful. And then moving to the other side, little circles. And if you're feeling weird, that's good. That's exactly where I want you to be. I want you to feel weird. And you know what? You're doing some good to your body, so whatever. Just enjoy it. Good. And now you're going to come back to the middle, and then you're going to start doing some cat-cows. I'm going to show you. with the inhale, you're going to push the heart open, and with your exhale, you're going to round the back. All right, you're going to go on for a couple of rounds of breathing at your own pace. Good. Breathe in, open up your heart. Breathe out, round the back. And draw the navel in, really creating that space in the body, massaging your organs. Beautiful. Good. One more time. Inhale. And with your next exhale, you're going to stay now with the back really rounded. You're going to push your hands on top of your thighs, really trying to create more space in the back. Again, push, push, push. And release. Good. Giving yourself a moment to just feel into that stretch. Beautiful. Okay, we're going to do all of this one more round. We're going to start with our hips again. So you're going to bring that foot back up. Maybe you want to deepen now the posture. Already connected to that asana, you know how deep the body wants to go. And then you're going to inhale and stretch your arms up. Exhale, you're going to turn to the leg that is on top, and you're going to start turning the body. Really keeping the chest open, and with every inhale, growing the spine more to the ceiling, and with every exhale, opening up even more. Beautiful. Now I want you to turn to the other side just for a moment. And then you come back to the middle and you change legs. Beautiful. Yes. Feel the stretch in your hip. Inhale, raise your arms up. Exhale, turn to the leg that is on top. Relax your shoulders. Good. Grow the spine. Again, inhale, exhale, twist even more. And coming to the other side just for a moment. Beautiful. We're going to go for the second round, cat-cows now. So you're going to inhale, push the chest open. You're going to exhale, you're going to round the back and draw the navel in, drop your head forward. Okay, 2 more rounds at your own pace. Beautiful. Okay, you're going to come back into a very comfortable seated position now. And then you're going to start just moving your head. Again, closing your eyes if that's comfortable for your body, and feeling into that movement, feeling your neck stretching, opening up, feeling how you're massaging your thyroid gland, activating really important hormones in the body. And then you're going to start turning your head to the other side. Just switch sides. And staying in this moment, no matter what is happening around you, focus to this practice. Beautiful. And now you're going to drop your head forward and backwards. Really creating a stretch in your throat and in your neck. And And next time your head is dropping forward, I want you to bring your hands to the back of your head, fingers interlaced. And if it's comfortable, you could start moving the head from one side to the other. Feeling that stretch in your upper body. And now really, really drop your head forward. Yes, that's it. Beautiful, beautiful. Good. And then slowly release. And we're going to come to some standing position. So you can come up, just a couple. And I first want you, if you have shoes, I'm inviting you to take them off to really connect, at least if you have high heels, because that might get a little bit tricky. And if you want to take your shoes off in general, like, you're very welcome to do that. I love to walk barefoot wherever I am. And then I want you to feel your feet on the ground, starting to grow into the floor and expand your energy, really connect to Mother Earth. And then bring your right hand to your belly and the left hand to your heart and close your eyes. And again, connect to this moment. Really feeling the breath. When you inhale, your belly expanding, your chest expanding. And when you exhale, feeling how your heart is becoming very light and relaxed. And now doing this a couple of times at your own pace. Connecting your breath to your body, to your soul, and creating that bridge between the body and the mind. Feeling your heart beating, feeling the quality of your breath. Beautiful. And then slowly drop your hands down, open up your eyes. And now find a spot in front of you that is not moving. This is going to help you to focus and find balance. Bring in now more weight to your left leg and starting to raise the right leg up as much as it's possible, and to maybe grab your leg under your right knee. Yes, beautiful. That's it. And now really roll your shoulders back, open up your chest. And now you could stay here, or if you want to move further with me, I'm inviting you to open up that leg to the right. Yes, that's it. And then bring the left arm to your hip. Yes. And maybe open up. Yes, beautiful. Yes, good. And if you're falling, that's okay. Just come back in, play with it. Be gentle with the body. Coming all the way back. And now we're going to go into tree pose for those who want to try. Yes. So you could leave the foot down, or you could bring the foot up, but you're not pushing on the knee, okay? So under the knee or above the knee. Yes. And then maybe bring in the hands in front of your heart in Anjali Mudra. Beautiful. Yes. Nice. Good. All these tree poses. And then just connecting to that moment, to that posture, to yourself. Good. And then we're going to release and just take the left foot. And now you see why it's better to actually take your shoes off, because you have that grounding, huh? Good. And we're going to change sides. But first of all, again, feel both of your feet in the ground. Feel connected. Your body, you're amazing. You're unique. You're exactly the way you're supposed to be. Don't forget that, to remind yourself, to feel all that self-love. And then bringing all that love down to your feet and connecting to the ground again. And then open up your eyes. Again, find that spot in front of you, starting to bring more weight to the right foot, to the right leg, and raise the left leg up. Maybe grab that foot, draw the shoulders back. Yes, beautiful. And if you want to go further with me, starting to open up your hip, and maybe the right arm goes up. The trees are dancing. Yes, amazing. Yes, good. We have some people at the back joining. That's nice. And then we're going to go back and try to come into tree pose. Maybe bring in the hands in front of your heart. And you're going to take all the time you need to settle into that posture. Yoga is all about the way, not the goal. The way and the time you're taking to connect. Good. Beautiful. And then we're going to just release and just relax the right foot. Maybe just little circles. Beautiful. And then we're going to inhale, raise our arms up. And when you exhale, maybe you want to go to a little spot where you're going to hit the chair in front of you. You're going to come and forward fold. Exhale. Come all the way back up. Inhale. And when you exhale, you're going to forward fold again. Okay, inhale all the way up. Again, raise your arms up. Stretch the body. Yes, exhale. Again, forward fold. Feel that energy. Yes, you're connecting. Inhale one more time, as if you want to grab those sun rays, that good energy. Exhale, forward fold all the way down. Beautiful. Now, roll the spine all the way up again to a standing position. And again, take a seated position on your chair. Beautiful. And again, don't mind what is going on around you. So this is the whole magic about the practice of connecting to ourselves. We do not hear what is happening around us. We connect to what is happening inside of us. So close your eyes again and connect right hand to the belly, left hand to the heart, again with your body. Breathing in, sending the breath down to your belly, to your chest. And when you exhale, connecting even more to this moment. Inhale, feel all the beauty you are. Exhale, send all that good energy down to Mother Earth and connect. One more time, inhale, connect to the moment, to yourself. Exhale. Beautiful. And then just drop your hands on top of your thighs. If you want, you can keep your eyes closed. Just for a moment. Feel the body. And then inhale, raise your arms up. One more time. And exhale, you're going to forward fold now on your chair. You're going to push the left hand into the floor. And you're going to raise the right arm up. Yes, beautiful. Really starting to opening up the lower and the middle back now. Then drop the right hand down. Inhale again. Exhale, left arm up. And you really want to try to look up. Gaze to your left hand or to the hand that is stretching now. Good. Now you're going to release again. You're going to take a moment to just move your head from one side to the other. coming all the way back up to sit on your chair. Good, well done. So we're gonna stretch our feet a little bit before we finish the practice for today. So if you have shoes, I'm inviting you to take them off. If you want to keep the shoes, don't worry about that. So you're just gonna start moving your feet a little bit to bring in some space into your joints. So we're walking with our feet all day long in shoes, and this is transforming and changing the shape of our feet too. This is really comfortable for the joints now. Really pushing your foot into the floor and creating space. Yes. And then you're gonna start just moving one foot, circulating, like really starting to push. And if you feel some spots that are uncomfortable, it's okay, just breathe into them. And then you're gonna turn to the other side. Yes, beautiful, almost done. And then drop the heel down and switch sides. We're gonna start moving that other foot. And really connecting to this moment. Recharging the body. There's a lot going on here the next day, so this is a good moment to recharge yourself. Yes, to yawn if you feel like something wants to go out. And then turn to the other side. Almost done. Yes. Beautiful. And then drop your heels back down. We're going to come into a little Shavasana and meditation. So if you want to lay on the floor, if you feel comfortable with that, you're welcome to do it. If not, you can stay on your chair. And you're just going to find a comfortable position, maybe stretching your feet a little bit. Really relaxing into your chair and allowing all the weight to drop down. So you do not have to keep that openness at the moment. It's more the connection to yourself and to the ground. Drop all the way down through your sit bones. And then close your eyes if your eyes are not closed yet. For the next minutes, as if you're starting to prepare the body to go to sleep, but you're still here. You're very aware of what's going on. And just observing what this is doing to the body, observing the thoughts without judgment. It's okay the way it is. And trying to create space for this moment of relaxation, of letting go. Maybe just focusing on the sound, on the music, on the sensations in your body, that tingling in your fingers, in your toes, little vibration. And now I want you to focus on your heart. I want you to picture your heart and to see how your heart is growing and becoming very clear and light and starting to expand all that love coming from your heart into the body, into all the organs. Starting to sense how your inner energy is growing so much that it's starting to move to the outside of your body, creating space for even more light around you. Yes, now staying here for just a couple of moments, enjoying your body, yourself, because you are exactly the way you're supposed to be. You are loved, you're held, you are supported, you are beautiful the way you are. starting to come back to your body and to reconnect to this moment. And to start moving your feet and your fingers, wakening up the body. You maybe want to stretch the body. Beautiful. And then coming back to a comfortable seated position to close the practice. Just close your eyes and give yourself a little moment of integration, observing what this practice has done with you, honoring yourself for showing up today to practice. And then to close the practice, bring your hands in front of your heart in Anjali Mudra if that feels comfortable for you. And just bow innerly as a sign of gratitude towards yourself and everything around you. Thank you very much for being here today and for sharing this practice with me. I wish you a wonderful day. I wish you a wonderful week here. And I hope to see you very soon again. Namaste. You're welcome. Thank you.